Downside though it is from up.
Which clause is that, sir?
This one.
Ah.
What is the gauge? 20?
Which gauge?
18 gauge, no?
20.
Guide wire.
വരുന്നോ ബ്ലഡ് വന്നോ
ഒന്നുമില്ല.
looks like it's in ഞാൻ അപ്പുറത്തോട്ടൊന്നും വരുന്നുണ്ട്. Yes. Please, all of you wear a gown when you are coming near, please.
ഓപ്പൺ ചെയ്യണം സർ, പുതിയത് ഓപ്പൺ അടുത്ത ഷീറ്റ് തരണേ.
ഗൈഡ് വരട്ട് നോക്കാം. എന്താ maybe because we are just pulling the vessel too much that it's not showing any blood.
Two ends, the flabby end should go inside.
Just let's see. It's going in. Oh no.
ചിലപ്പോൾ വാൽവ് ആണോ?
Just see. I don't know. Not much came.
Now it is freely going.
Oh no.
Once this one is inside, next step is we will take out the camera.
That
Next,
cover it.
this one is having a
കുറച്ച് പറ.
inner sheath
This black one is an inner sheath which is pointed.
and the other one is an outer sheath. So we go inside this one.
Make sure that the guide wire is seen outside before you enter. Otherwise, you will miss it. That's what typical. Then you have to make the incision on the vessel so that it will permit it to go. Otherwise, it may not go.
This will be the restricting part, so that it should be vessel deep. While we are making incision with the number line.
Very good.
So I'm
You saw that it
Yes,
went
this-
in
this
smoothly.
inside. Once it is in, take out the guide wire, then followed by this sheet.
And maybe you can have a test.
What you can see.
Can you see blood is coming?
We are picking inside the wait. Switch up.
Yeah.
Middle holder.
ഇല്ല അത് വരത്തില്ല.
Here we are fixing sheath to the vein.
Can you see there is an ear given for tying it? Otherwise, what will happen is when you are trying to pull out the probe or something, radial fibers, no, even this will come out. You will not know. So it's better that you tie, and towards the end of it. Okay.
This should be
Okay. Tie. He is taking a bite through the vein. It was so big. If I have tried without this way, no, the formal cannulation, if I have not done and tried to pass through, it may just bleed and it will be messy. So what we have done is like we have ligated the vessel and then do it. But if it's smaller vessel, you can very well just hold it and put it and then tie around with the cannula. Then we may not use the needle to puncture and see all those. Directly you are into the vessel without even that obturator, that black one, you can try and put it. So anyway, you have to cannul it. This is one way of actually trying cannulations also. Reverse cannulation. We were just telling about reverse cannulation and correct patient. It's like reverse cannulation only is possible because of the sclerosis. Madhyata. May not be necessary because we have gone in for a puncture only. No need, no need, no need, no need, no need, no need. Doesn't matter. Just cut all those. This we are not leaving. Okay, ಇದು ವಚ್ಚಿಟ್ಟು ಕಟ್ಟು ಬಸನ. Retail not work. Yeah, retail tie only working because it's not looking later. Retail slip out in these areas because it's. Purple. Purple tie down. Purple എടുത്തോ. Give me the laser probe, light it.
Right off.
Laser on. This is what Dr. Pai was telling now. This is, can you see the black mark on this? That shows, with that you should pull out even this cannula. Sheath you have to pull out because otherwise you will burn that area. We have done that. We forgot to pull out that. And there is a piece of tissue, plastic inside. You have to excise it. So that's very much possible. Forgot that this was pulled out and finally energy was delivered to the sheath. Then each 10 centimeter there is the double marking, no? You just count its frame. That means 40 centimeter, 5 is there, 50, like that, no? It is. Can you see? It's like 1 mark to 2 mark, 3 mark, 4 mark, like that, no? You know how much it is.
Again, before inserting, make sure that
Light is there fully. Light is fiber is good means entire circle it will be there. Can you see? You can see some light or what?
OT light, മറ്റേ light കൂടെ off ചെയ്യാമോ?
OT light off here. Going beyond. You understood there was some resistance and I put it, tuck, it was going in. That means there was some valvular thing mechanism there. There is something there. It's coming there. Super. Just bring it up.
You have to move and come that side of it.
I think the side.
There will be bunches there. Can you see? Now just maintaining some kind of a patience. It has gone inside a little more, no? Every point. If it goes into a larger vessel, then very difficult to manage it.
It is behind the knee. Now we are inside the OT light on here. OT light on here.
I was lucky, I would say.
Usually
It went. So when you see this, you just pray and then do the thing. It's not possible to manage up to below knee. You have done it. You are almost means ligated, and up to there you are done. One major vessel, and you are thinking. So we are thinking we will at least put some screw and see if something can be done. I'm just trying to see what is done. My purpose is done. Give me more length. Hmm. That's going from one end to another. Yeah, no, not really one. But at least I'm happy with the below 6688 territories. Because I'm going to the four territory. This advantage of seeing and going will be very good with laser. There is, you'll find. It's tributary and it is just blushing out, no? Your typical accelerated version of a freelance will have so much of a different there. It is tree, so usually it's a vessel. We can manage. So I was telling it to stop. Don't try to be over smart by pushing it further.
Can you see that? You can see that
White spot.
area, no?
No, by ഒന്നുകൂടെ കാണിച്ചാ with some shadowing below. By
That is the laser probe inside.
കാണിച്ചായിരുന്നു.
Yeah, that one.
Proper കാണിക്കും. Did everybody understand? Yeah, yeah, it is floating. Wait, sorry. Better നോക്കിയതാ.
Better okay.
You're not telling, no? Yeah, that is something good. Bright spot, no? Bright spot in the upper vessel. Upper vessel. Yes. He's just showing you. But he can show so many vessels. Yeah, that light shadowing you saw, posterior shadowing, that is the classical of a foreign body kind of thing, no? Scleroscent also a good quantity will have that kind of a typical lower shadowing. In gallbladder, they show it, no? With stone, there is a acoustic shadowing. So you can see a light thrown from that area. Yeah. See? Yeah. It's like a torch, it's happening.
Inside the vein now, other areas are black. Correct. Once we inject the sclero, there will be like pinpoints. So like we will say it's a starry type. Next step will be tumescent injection around the vein.
Tumescent, you understood 500 ml saline, 10 ml of soda, bicarb and 15 ml of lux.
It can go that is usually soda bicarb ampoule is 20 ml, lignocaine is 30 ml. So half each, half vial each.
But you take a 1 liter saline, that also half. Half ampule, half ampule.
Soda bicarb, half ampule. Or 1 liter. Yeah. This one, how we are doing is IV set will be connected to a 3-way, and from 3-way we will attach a 10 cc syringe, 10 or 20 cc, preferably with the lock. Okay. And it will be connected to the third limb through an extension, 100 centimeter extension, and the tip we will be using. Spinal orange color spinal needle.
What is that beige orange color?
Orange color. If the skin is too thick, we can use thicker spinal needle also. Using spinal needle will help us if once we puncture that, it's a longer one than normal needle.
Which is getting stuck at some point. But I'm happy it's coming up to that area. At least 3-4 areas of catches were there. Somehow it managed.
ഒരു പണി ചെയ്യാവുന്നതാണ്. If you want to do laser, you can just granulate it here. And so in the package, you can put another.
Just show me, I think. Show me that with ultrasound.
Vein count. This way. No, it doesn't count here.
25 വന്നിരിക്കണം.
This one.
Stop light down. Stop light on.
Hey, no. ക്യാനിലതാ അതെല്ലാം പോകുന്നൊന്നും പറയാൻ പറ്റത്തില്ല. ഇതെന്തുവാ?
ഫാറ്റിന്റെ
മറ്റേ just to see how it is being done, just may not have so much of an advantage here. You don't know whether it is going. It is just up to 1 point only. Not going, no. Keep it there. You can inject scleral. Okay, you want to change. It is into junctions, not permitting. Where? Gone?
Yeah.
Okay, just for showing how it is being done. See that cannula is taken out. Then they are just loading with this black and all of you seeing?
Knife.
And make sure that the length is sufficiently outside. Then an incision with a sharp blade is done at the junction. Don't cut it off. By that, if you say also, sometimes it will happen, no?
Laser probe ഒരെണ്ണം ഇടയ്ക്കിടാം.
Okay, we made a skin cut. Stretch it so that the skin doesn't go. See, he went in.
Probe ആണ്.
Okay. See, that is something which is cannulation you saw. The rest, I don't know how much it will go. Distance. See, he has taken out this thing also. Blood comes, it is lottery. Yeah, it's coming. Yeah, okay. Whether few centimeter, just wanted to show one more of a cannulation and this thing.
Let it be here. We'll do this and then
Wash the left.
Sorry, I'm sorry.
ഇത് അവിടെ അല്ലേ അത് ആയിക്കോട്ടെ എനിക്കിത് മതി.
So if we will be making one incision towards the
Usually they will bring at least 2. And where these are like reusable. ഒന്ന് കണക്ട് ചെയ്ത വേറെ മെഷീൻ ആണോ?
mostly they will take care of the rest of the things will take care of
ഇതൊന്ന് പാസ് ചെയ്ത് കൊടുക്കും.
here.
At 2 times. 2 different times only. Now he has to disconnect and then do it. Just change it.
Top light again.
Make sure that you are not just bending, no? These things are not like drip set. If you bend it, it's gone. Usually 30,000 or so, no? Yeah, don't do that. Just because we did not untie that area and we are pulling, no, that glass piece actually was remaining inside. We have done so many combinations. That is a very confidently we are telling what should not be done. We hard pull, no, to bring it out without cutting that thread, which is, occluding, and the glass was remaining there. The fiber was wasted, and testing and seeing whether it is light is there all through. Pressure is great. It has gone up to ulcer and beyond. Done. Now all yours. Where is your glove? It's there. Okay, good. I'm checking everybody for sterility.
Top light on.
ആദ്യം ഇത്
No, this can be done.
no if tumor is given here I can continuously take when the tumescent will be injected there.
Oh,
Otherwise, this time is simply lost.
okay.
Uh,
What he's telling is if
the-
tumescent is given up to above the level, first go, then rest of it he need not actually have tumescent.
Okay.
Huh?
Because that will be thicker.
sufficiently, yeah.
It's okay only, let him. So what he's telling is give tumescent up to here, go for this so that it can be done. But I'm sure, can you give the tumescent because he may not be seeing it. Just show the vessel wall and do it from there.
Sharp ആണ് കൈ കൊണ്ടുവരലാതെ.
Another thing is, wait a second, this whenever we are telling somebody to aspirate and see, somebody will aspirate and see here whether blood is coming. Is it right? Now, aspiration and seeing will be here. They look at there only. You say aspirate, no blood, do it. They are checking there. It will be all through this only. Then, even if you punctured vessel, no? So you should see at this area. The moment you puncture, it will be seen. Make sure your assistant is not putting you into trouble. Yeah, that is okay. That anyway.
Foot pedal is side the
Aspirate.
Aspiration ഇവിടെ നോക്ക് പൈസ കാണിച്ചില്ല പയ്യെ കവർ ചെയ്ത് പിടിച്ചിരുന്നു.
Air ഉണ്ട്.
That's okay, boy. It's okay.
Push.
Why he was worried about air is that will show like a sclerosid inside.
Pushing, sir.
It will not look like a saline.
Freeze ഒന്ന് കൂടി കുത്തണം.
Please, കുറച്ച് പറഞ്ഞോ.
മതി മതി നിർത്തിക്കുന്നു. Aspirate.
Aspirate.
Push.
അവിടെ കാണിച്ചത്
കുറച്ച് മേലെ വരുമ്പോൾ
Pushing, sir.
വലിയ സിറിഞ്ച് എടുത്തോളാണോ?
Aspirate.
Yeah, okay. All these areas, it's maybe better if you have a syringe with
Push.
lock system, liver lock, no?
So 2 syringes we can.
I am. This is very superficial. I can feel the. You can just feel that sheet.
Sheet. Okay. Try.
Right. Right.
Did you get it?
So that is why I am not checking with the ultrasound. I am just sorry. You can feel.
Who else?
I am just giving it.
Whenever keep
Superficial.
try to
Aspirate.
നോക്കണം.
Aspirate. Push.
Not for style, but even if this light, no, if you're seeing the light, it's possible that you can get a
Can you see my
laser.
needle? This is my needle.
needle, you can see.
Yeah.
Push ചെയ്യണേ.
No. See, needle is seen as a bright line.
Okay.
Sir, push.
And
There you cannot make out which is vein and which is thing.
just see the plane when he is.
I will show above.
Yeah, see that is the probe there.
Yeah, there is the probe.
See, if anybody is not understanding, now shout. Hey, show me. Like that, no, don't just keep quiet, thinking everybody else understood. Those who are not making noise mean they also did not understand. Just keeping quiet, that's all.
Yeah.
Yeah. So just tell. Okay, you come to learn, ask. We are there. That's why 3 of you.
Can you see the needle?
Needle
I can see the vein.
this thing also.
I have to go to the sheath of the vein now.
Now you can see he
Aspirate.
has just actually made an indentation of the vessel.
Aspirate.
Aspirate.
There is no blood is coming. Now push.
Pushing, sir.
You'll see the. See, can you see? See that vessel is just moving away, no?
Vessel is moving away from the
And
skin
vessel wall
and
is
the
seen
somatic
also.
structures.
Perfectly there. Just around.
Okay.
That is
Stop.
the best part.
Here again, I am taking the vein.
So you are doing it perpendicularly, sir. to the vein, or
On an
like we
angle.
can do in any way.
In any way.
Yeah,
anyway.
in any way we can do it.
Sir, aspirating,
Okay,
aspirating,
aspirate.
aspirating. Pushing.
ഏതിലാ ഇപ്പൊ ലൈറ്റ് ഉള്ളത്? മേലത്തേലാ?
Can you see small white spots coming there? What are they?
Here.
ഇങ്ങോട്ട് നീങ്ങുന്നു.
Yeah.
പറഞ്ഞിട്ട് ഇത് ഭായി കാണിച്ചു കൊടുക്കുന്നത്. Let them see how actually a good tumescent injection around is possible. Imagine if it's local and you make 100 punctures here, like that, no? You won't take it yourself, no?
Even without ultrasound, you can see that vein.
Yes.
You can just go between the vein and the skin like this. Aspirate.
Aspirating.
കാണിച്ചു കൊടുക്കും.
Pushing. Pushing.
Can you see?
If you're not able to see, just move your position. Can you see? Okay, very good. I can't see.
I am gradually pulling it down.
നിങ്ങൾ ഇപ്പുറത്ത് വന്ന് എന്താ? ഇപ്പുറത്ത് വന്നു. ഇവിടെ ഒന്ന് ചെയ്താൽ പോരെ, മേളിൽ നിന്ന്.
Can we use pink infiltrating needles, almost 10 inches, 8 inches
Long.
long?
Longer
then-
ones you can use, but it's a bit difficult for you to manipulate those.
No, this itself is too long.
That's why we are
This
using
is
the
spinal needle. This is
Spinal needle, no, it is itself is like at
Push.
least 5-6 centimeters. So your segment wise only you can do. You cannot just put along, means like a guide wire, no, you're telling,
It's not
or
like
like a probe.
Like what we use in lipo.
Not here.
We have a thin.
Can you see?
and,
That is little bigger, no? Not like very thin like this
Not-
hair. Huh? Not?
Little bigger.
Yeah, that's what. So that puncture itself will be like difficult.
Correct.
So this is the best option. You have so much of length. Some 5 centimeter, 6 centimeter segment is taken care. Better you can be around. And if once he get a very good plane, he will keep it there itself so that it actually goes along the vessel wall. Yeah. ഇച്ചിരി റസൻ ഇങ്ങനെ റസൻ ഒന്നും അല്ലാതെ കവർ ചെയ്ത് നിൽക്കുക.
Vision activity.
Yeah.
Regarding.
Can you see the needle now?
Sir, aspirating.
Yeah.
That moving one is the needle. Below is the
അപ്പുറത്ത് ചെയ്യുമ്പോൾ എന്നോട് കൂടെ ചെയ്യും.
above one. Just that is the needle. Below is the vein.
Correct.
Yeah.
Don't
Okay.
touch, huh?
Aspirate.
Aspirating, sir. Aspirating.
No blood is there. Push.
Pushing.
You religiously see this aspiration thing and all, no?
At this region, we are least bothered about the nerve part. We are bothered only about the skin part.
Like 1 minute you break. Dr. Sen wants to show the laser settings and then.
We don't need, right, sir? Close approximation of the nerve is, we
Yeah.
don't need.
Yeah. Before next puncture, just wait for it. Just see the firing the laser because you're already done up to. He can actually simultaneously do it. When 2 surgeons are there, let us utilize the second surgeon's
Yeah.
availability.
You can see there is measurement, I mean, the values are showing watts.
Yeah.
And joule,
Down.
okay? Setting and opening. Here again, it's written power, pulse time. Okay, so we can alter the time and the watt. So the entire energy given will be multiplication of these two. Okay,
Correct.
understood?
Okay.
Joules is equal to watt into power. I mean, watt into time. Yeah, 6 watts, 6 seconds.
Then it will be. And it will.
It will give a beep. So we will be delivering 36 joules in each centimeter. And we will start with that. We will assess how the catch is. If you want, we can increase also. Okay, ready? Okay, and we are putting, we are already given the tumescent over the vein. Additionally, we are placing an ice also.
Ice
give
with
the
a
compression.
mop cover so that you will hold it for longer time.
Each time, once it is
Is it-
full, make sure this light also will be
Mallu.
going up, no? The assistant should come along with that so that it is going along with how much far we are pulling out the laser fiber. So foot pedal is with me. I'll be keeping on pressing the foot pedal. Each time once the energy is delivered, it will give a beep sound. And I can pull 1 centimeter. There is marking on the laser fiber for 1 centimeter.
Another thing you should remember is when you are using two, no, don't keep it near another one also. Yeah, fry that. I'm worried about my second one. Okay.
So I'm starting.
Can you now come back to the ultrasound? Can you see that saphenous eye? Vein and a fascia above and fascia below. That is what is called saphenous eye. And in that saphenous fascia, you can puncture. Can you see the tip of my needle? I have to go. Okay, aspirate. Push.
Aspirating, sir.
Blood is not there. Push.
That command has to come from the surgeon. No blood, inject. I means you may do it 10 times, that's all, no? Not even once, you should be into the vessel.
Can you see in the fascia, the blood is,
Is separating. Done, sir.
Here again, we can appreciate here at least we have put ice for few minutes. Here only
stop.
2% was given. You can touch and
Touch
see
and
how
see the cooled.
cold is already. There we have put
Without
ice
ice.
something. But see here, we haven't put ice yet, no?
Very cold.
See.
Soda bicarb as such you take, it may not be cold, but combination is cold. Do no? Yeah.
Ice, please. I'm
Aspirate.
activating.
Yeah.
Aspirate.
So you have to concentrate whether you want to see.
Aspirate.
You heard the sound?
Brother, aspirate.
It is cracked.
Aspirating, sir.
അല്ല ബ്രദറിന് പറ്റുമോ ഒരു
You
കൈ
can
കൊണ്ട്
see
പറ്റുമോ
the
രണ്ടും കൂടി
Rain also that deep sound
എന്നിട്ട്
came.
ഞാൻ സിസ്റ്റർ
I am pulling out.
ഇവിടെ നിൽപ്പുണ്ടായിരുന്നല്ലോ
അശ്വിനി നീ ഐസ് പിടിക്കും.
That deep sound. I'm pulling out once in a
Sure.
Heard the sound?
Like
Indirect.
you are hearing. And I'm getting a good catch also.
Crackles.
Yes.
If you have not heard it, fry popcorn today.
ഓക്കെ നിർത്തിക്കാം aspirate
Aspirating. Sure.
push
ലൈറ്റ് നോക്കണേ
Sound 1 centimeter.
കണ്ടോ ഈ കേബിളിന് വെറുതെ വിട് ലൈറ്റിന്റെ കൂടെ പോണം കേട്ടോ
Push. This was the total fuel delivery. Okay. So it's getting added up. Like 36 plus 36 like that is going on.
push
Okay. I am keeping on pressing the button. One beep sound.
നിർത്തിക്കാം
I will.
അമർത്തി വെച്ച് കാണരുത്
Sister,
aspirate
അതിൽ നോക്കുകയും ചെയ്യരുത് കേട്ടോ ലൈറ്റ് ലെസ് നോക്കരുത്
push
Can we see the light?
yeah, we can see the light.
ജസ്റ്റ് ഈവൻ ദറ്റ് ഫ്രൈയിങ് സൗണ്ട് എവറിഥിങ് ഈസ് ഹേർഡ് നോ
okay fine
ഒന്ന് ലിഫ്റ്റ് ചെയ്ത് കാണിച്ച ലൈറ്റ് ടോപ്പ് ലൈറ്റ് ഓഫ് ആരാ കേൾക്കുന്നത് ശബ്ദം ഉണ്ടാക്കി കേട്ടവര് ജസ്റ്റ് ഷോ ലൈറ്റ് ഓക്കെ വൺ ലൈറ്റ് ഓൺ പൈസ ഒരു അൾട്രാസൗണ്ടിൽ കാണിക്കുമ്പോ
top light വേണ്ട can you see there are bubbles there
I'm activating now I am low.
ഒരു ചെയർ എടുത്തിട്ടോ പ്രോപ്പർ ചെയർ എടുത്തിട്ടോ ആ ഓക്കെ ചെയർ എടുത്തുണ്ടോ അവിടെ ഇല്ല
Crackles in the sky.
Yeah.
ഇത് മതി
Bubbling.
ഇത് മതി
because of heat it is bubbling
ഇവിടെ ഇട്ടോ വേണം
Ice back.
So
Okay,
verification,
you can give
Right. Every shot you need to put eyes.
No, you will keep on ascending the ice also along with
Top
the
light on.
pulling out. So that will give an additional.
you can hold it
Ice. That
saline will be kept in fridge and it will be that cover saline and it will be broken and taken it will be sterile and it will be put in a gloves or else what you can do is just ice you can put in a sterile this gloves and tie but At times when it becomes water, that water can come out, which will be unsterile. So it is always better to keep sterile saline cover in the fridge and take it as it is. So it will be sterile. You can
Good,
break with a
very
hammer and
nice.
take it.
ഉണ്ടോ ബോട്ടിൽ വെച്ചിട്ടുണ്ട് വേറെ ഒരെണ്ണം കാണിച്ചു കൊടുക്കാം ഇത് കഴിഞ്ഞിട്ട് മതി സിസ്റ്റർ മറന്നു പോയത് 10 minutes കാണിച്ചു കൊടുക്കാം ശരി കാണിച്ചു കൊടുക്കാം എങ്ങനെ എടുത്തിട്ട്
കാരണം എനിക്ക് അൾട്രാസൗണ്ട് ഒന്ന് കാണാൻ വേണ്ടിയാ ഒന്ന് അഡ്ജസ്റ്റ് ചെയ്ത് നിന്നാൽ മതി
ഇവർക്ക് നല്ല വീതി കൂടുതല
അൾട്രാസൗണ്ട് മെഷീൻ കുറച്ചൊന്ന് ബാക്കിലേക്ക് എടുക്കാം
നീലിമ അല്ലെങ്കിൽ പ്രവീണോ ഉണ്ട് ഇവിടെ ആരോ somebody want to go early they can arrange lunch so that they can have it and go.
Can you see that probe? Right, here it is a probe. Okay, now the
ഒരു ആൾക്ക് നേരത്തെ പോകണം അപ്പൊ ലഞ്ച് ഒരു 1:30 കഴിയുമ്പോഴത്തേന് എത്തിക്കാൻ പറയണം വെജ് ആണ് 1-2 പേരുള്ളത് ഒന്ന് നോക്കാൻ പറയണം ആരൊക്കെയാണ് എനിക്കും ബൈക്കൊക്കെ വെജ് ആണ് എൻ്റെ റൈസ് അല്ലാത്ത എന്തെങ്കിലും വാങ്ങിച്ചു തരാൻ പറയണം റൈസ് ആണ് ചപ്പാത്തി എന്തെങ്കിലും വെജ് കറി മതി എനിക്ക്
push. Here the vein size is small. If I am not getting fast enough, I will increase it again.
Now already it's 8 and 8, no?
Can you see now?
Sir, 8,
Now the needle
8,
has
8, okay.
gone below the vein.
Eh?
That vein is getting
Okay.
lifted up along with the
Okay.
needle, right? So I should be more superficial.
here it is shown now 64 joules. So I will start with that one. See, I am trying to push back in now.
As per
Left feet.
Ah.
It's not going. Okay, means that is solution.
yeah.
Yeah. Okay, it's now. I say. Rotating again.
That freeze somebody has to press freeze.
2 times.
We're getting a backlink down.
Okay, now the needle is superficial. Can you see?
Backlink feel also.
Now the needle is
രണ്ടുപേരും
superficial.
ഒരു സമയം സംസാരിക്കാതെ പോയി.
Just say 26.
No. Once the little energy is delivered, that will give the result.
Can anybody show me the cable?
Hello. Brother അല്ല ഡോക്ടർ
Right.
ഈ മൂവ് ചെയ്യാൻ പറയാം ഡോക്ടർ ജസ്റ്റ് no it's okay you can see small space
As per push.
Now I'm not getting enough cash. I think
Yeah.
I have to use the, energy.
You can see that the vein is getting pushed down, right?
But in the microphone is there. I want to breathe the energy.
So this fluid can collapse the vein also.
Sir,
It can keep the nerve away. It can protect the
Huh?
skin.
energy increasing. 75.
okay
Okay, stop.
Stop.
try to put more of a head load means but nothing much already ligated may not be useful by Tandrambak tilt. You can tell somebody who is doing the pressure part no to compress it
Press.
more.
Push.
72.
Catch ഉണ്ടല്ലോ അല്ലേ? Just catch ഉണ്ടല്ലോ.
Okay, sir.
മതി.
That is why 26.
See, now this one, we just increase the time. It's no more.
പറയുന്ന സാധനം ഉണ്ടോ ഇല്ലെന്നുണ്ടെങ്കിൽ വേറെ പറഞ്ഞിട്ട് ചെയ്യും
No.
Better
You wanted to poke here, right?
increase the time. Again, next option is I can withdraw 5.5 seconds. I mean 0.5 seconds.
Initially, yeah.
It's no more.
Now we are seeing that.
Additional option.
Okay. Yeah. In this direction, puncture here and go beneath this probe. Just this much you have to go in. The middle point.
Next is. Is the middle. Yeah, that's one more. Yeah, that's one.
Can you locate the needle?
It's not easy.
It is very away, right?
Ah.
You have to bring it towards the,
Okay, comes next bit.
just see, taking out and doing it here.
See, that's the catch. Okay.
Can you see?
Read it.
It is there over the vein, right? Okay. Aspirate.
And make sure.
Is blood coming?
This also, once
Now
the
push and see
continuous
that.
black mark comes, we have to withdraw with the sheet. With the sheet, we have to withdraw.
Is it going in?
Right or not, yeah.
കേൾക്കുമ്പോൾ ഒരാൾ യെസ് എന്ന് പറയും. യെസ് എന്ന് പറയടോ ആരല്ലോ? Who did it that? ആരല്ലേ ഏറ്റവും
Stop.
തന്നെത്താൻ ചെയ്താ നാട്ടുകാർ ചെയ്താ നിങ്ങൾ ഇല്ലാതെ.
In this way? Yeah, we can keep.
ബാക്കി സ്ക്ലീർ എടുത്തപ്പോ ഈ സൈഡില്
Now there are two marks, means 24 centimeter.
Madi sir,
എക്സിഷൻ വേണ്ടല്ലോ.
accession വേണ്ടി വരില്ല.
നമുക്ക് ബാക്കി
That is the probe. Probe.
കാണിച്ചു.
Yeah.
2cc into 10cc.
Yeah. And
അവരെ
this is my
കാണിച്ചു
needle.
ലോഡ് ചെയ്യണം. പറഞ്ഞുകൊണ്ട് ലോഡ് ചെയ്യാവോ?
Push and see.
എടുക്കും.
Can you see?
കുറച്ച് പറയണം.
It is spreading along the vein.
ക്യാമറയിൽ കാണിച്ചു ചെയ്യണം കേട്ടോ.
Happy? Yeah, stop. Now again.
ലിവർ ലോക്ക് എടുക്കുന്നത് എല്ലാം കാണിക്കണം കേട്ടോ.
Probe. Yeah, I located it. Okay.
എന്റെ സ്പെല്ലിംഗ് എന്താ ലിവർ ലോക്കിന്?
Can you see the needle coming?
Light on.
You.
Aspirate. Okay. Push.
ലോക്കിംഗ് സിസ്റ്റത്തിന് ഒരു പേരുണ്ട്. ലിവർ എന്നാണോ ലിവോ?
The below white line is the laser probe.
അടിക്കുന്നതിന് മുമ്പ് അലർജിയാണ് എന്റെ അടുത്ത് പറയുമ്പോ.
Scissors, please. Scissors and
Rather than taking out, I advance a little.
ഒരു മോപ്പ് കൊടുക്കും.
It's a continuous line. I can see.
Just everybody concentrate what Dr. SN is doing, that untying that area which we are ligated before removing, otherwise half the this thing fiber will remain there. You'll have to pay for it and do an excision also, and it's not that easy in the thigh. In the leg it's still okay. Tie and free that area, let it come out, and once it is 10 centimeter mark is there, that black continuous mark is there, you need to remember to withdraw that outer sheath also, otherwise you will fry that and we will get into trouble.
So I have cut the tie connecting here to the vein.
അവരെ കാണിച്ചുകൊണ്ട് ലോഡ് ചെയ്താൽ
Top light
ഇത്
on.
ചെയ്യട്ടെ അന്നേരം ആവട്ടെ.
Top light on.
അല്ല അത് കാണിച്ചു കൊടുക്കാൻ അത് അതങ്ങ് ചെയ്തിട്ട് ഇത് ചെയ്യുമ്പോൾ കാണിച്ചു കൊടുക്കാം.
Off fire. Laser mark is there now. Yeah, we can see here. You can see here, no?
ഈ സൈഡ് ഇത് മതി അല്ലേ?
So I'm activating now.
മതി ഒത്തിരി ചെയ്തിട്ട്
ഇവിടെ പഞ്ചുള്ളിടത്തും ചില കൊളാപ്സ് ആവാത്ത
എല്ലാം ക്ലിയർ എടുത്താൽ മതി.
ഇവിടെയും ഇവിടെ ഒരു ബഞ്ച്, ഇവിടെ ഒരു ബഞ്ച്, ഇവിടെ ഒരു ബഞ്ച്.
Continuous, you can
പ്രോബ്ലം ആവും. സ്പേസിങ് ശരിയാവില്ല.
So I'm pulling up this one. Also with the teeth also once.
കാണിക്കണമെന്നില്ല.
ക്ലിയർ കൊടുക്കണം, 5 ഇടത്തോട്ട് കൊടുക്കണം. 2cc വെച്ച് കൊടുക്കാൻ ഒരു
So
10
half of the line should be visible and half will be. That is it, so that we won't lose anything.
മറ്റേ വിളിച്ചില്ല അല്ലേ?
Continuous, continue. Yeah, that is losing.
Anyway, crackling is there good. That means patient will have a good result. Right energy.
Sometimes this thing will be coming out, then.
See, imagine in this case, you are thinking of only laser. One is like cannulate from here, it's going to be difficult. Number two is like such a big vessel. If you don't like it, you are inviting a second procedure. Preset for a second procedure. So this one, we know that saphenofemoral is not going to anyway. Long saphenous vein is treated fully. If at all some other vein comes, it is another vein, not long saphenous. So at least the vessels you have treated should not trouble the patient again. Another vessel which is dilating tortuosity, it's okay. That's a new disease. Treated disease should not come back. Recurrence is something which can be avoided. Varicose veins, it cannot be called as a recurrent that time. Reoccurrence of another vessel or another vessel vein getting into trouble. That is acceptable. You cannot do anything about his entire legs and veins because these are necessary for a drainage. You cannot just block it completely.
Top, now the sheath is out. Top light on, please. Now I'm pulling out the sheath.
Those who are near now, if they are not wearing a goggle, should not really look at it because that is an area where it's coming out of the vessel. Then you can get a laser exposure. Once inside tissue, it may not be. So you can look at resin and then stand.
That smell of frying tissue is also there.
Yeah, if you are good at smelling.
This much part more is there inside.
Bro.
After that, again, a continuous parting will be coming.
Cerebrum.
So that picture also have 2 seconds. One more marking is there.
Tie all ties.
Stop for a second. Just hold for a second. See, now again a continuous black line is there.
Yes.
Can you see that? So that shows another 1 more centimeter is there. That will be the last part. Okay, so I finish that.
Now don't look.
Last fry. If it was cannulated through, another area was a good thing. So vessel was collapsed.
This finish.
Clean the tip nicely after taking it out. Okay, now energy source can be.
Clean and take it out.
Yeah. That's all right.
Chamber.
ഇനി ഇപ്പുറത്തേത് കണക്ട് ചെയ്യാൻ.
By the meantime, he will, brother, give it.
No. First one is
See, yeah.
continuous black is this one. Then the next black is this one. So once we see that, one more right. This part, last 2 centimeters only. That will even.
എത്രയാ
one more,
വെക്കുന്നത്?
that will finish off our opening. No?
16.
Ideally,
6.
drainage is
One.
don't need to super it again.
6 എടുത്തത്.
That will be charged.
6 വേണം.
Now 4.
4 മതി.
ഈശ്വരൻ നമ്മൾ സ്ഥലം എടുത്ത് ചെയ്യാം അല്ലെ
സൂപ്പർഷ്യൽ
അല്ലെ ഈ സൈഡേ നമ്മൾ സമയം എടുത്ത് ചെയ്യാം പിന്നെ അപ്പുറത്തേക്ക് നിങ്ങൾ ചെയ്ത് നിർത്താൻ
We
മതി
started pulling out once we saw this one. Okay. Yes, another.
സൗത്ത് എനിക്ക് താഴെ.
We should not miss that. Another approximate.
സൗത്ത് എനിക്ക് താഴെ.
So again, once we see this, stop firing also. One more white. Stop. Otherwise, it will be fully. Yeah, otherwise, it will be fully exposing to the entire.
You had some query, no? Listen. Tell loudly, doctor.
What we saw, there was a charred tissue on the tip of the radial fiber.
That is the last part.
My question is, what is the energy emitted? We don't know where it got charred. So what is the emission of the laser? Is it even the charred surrounding on the tip? Is it okay?
Yeah, charred surrounding tissue will not emit as long as you are not activating.
Like we see in a cautery, once it's charged, it doesn't,
Finish off with that, yeah.
Energy.
Yeah, that is why we should be careful with the specs. Goggles,
No, sir. I think the question is, he is telling if it is charged, no, we will clean it outside.
yeah,
But when we are pulling it inside, we'll not keep on removing and seeing
yeah,
whether it's charred and
cleaning of the tip is not happening, but still it will be, still it will
We
be.
saw there was a bunch of tissue, just charred.
That was only just a blood clot at the end. That is not an
Actually,
issue.
that is not from the end part. I am forcibly pulling it out, no? It's from the tendon. Usually it won't.
We don't char.
Here, this part, the laser is getting emitted. And the chart was here.
That is only at the end. Yeah, that's okay. See, see, now you just, by the time it's getting connected, now just see how they are taking the petrol.
Laser.
Anybody wants to see? Yes,
You can see the
you
petrol
can see
getting,
how he is taking the petrol and mixing.
you all can see petrol getting mixed.
We are taking 2 cc.
He has taken a 2 cc syringe. Loud, 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 loud.
10 cc.
Brother,
10 cc level of taking in channel.
Here I have-
level of syringe.
Sir, ഇത്
2 cc, sir.
four ആണെന്ന്
One ample
പറഞ്ഞേക്കണേ സാറേ. സാറേ,
Then we are taking another one similar.
four ആ വെച്ചിരിക്കുന്നതെന്നൊന്ന് പറഞ്ഞു മതി.
The level of syringe
I'll
8
wait
cc
you.
we are taking air.
Anyway, let him take.
Air, just air.
Okay.
We are connecting into the stop valve.
Just show properly.
Like this. Consider will prepare like this.
See, he is doing that. No, otherwise it will splash. Especially if you are not having a specs. No, splashing is something which, yeah.
Then we will mix it up.
This also make sure it's tight. Otherwise, I'm sitting near. Huh? I can't do that.
Like this.
ഒരു സൈഡ് എല്ലാം ടെക്നിക്കൽ അത് വേണ്ടെങ്കിൽ എക്സസൈസ്
And
ചെയ്തു
once this 10 cc is over, we can take.
another 2 cc and make it 10 cc. Yeah.
Is there any?
കാണിച്ചോ
No,
അതെ
really.
froth ആക്കിയോ froth ആക്കിയോ how many times you did 20 times 20 times and it's froth every time you are going to use no make it again like push to each side
ശബ്ദം കേൾക്കുന്നില്ല.
Is there any maximum limits of?
fluorescent
It's out to 99.
Not,
In the
but
socket.
we are like we are using multiples of treatment so don't make it see once is used no just make it you are making a larger circle so that it is not bend and breaking.
Are we
Don't-
giving, are we giving any post-operative DVD prophylactic?
Yeah, especially if you see some kind of a sclerosant gone into the deeper system, then we give. Otherwise, it may not be. Probably no, because we want all these areas to be having a good stickiness. But if you think something has gone inside, at least a single shot of heparin, low molecular weight heparin is given. Yeah.
ഇതാവുന്നില്ല.
എന്താ?
Can we increase it to
6.6.
6.6?
You heard him telling he is not getting the catch, so he is increasing the energy from initially he kept it 16. Now it is increased to 36.
We need not go below. Medial valve.
Yeah.
No, below it's already done. No, below it was done. Up to medial malleus. Actually, it should have been above the ulcer. Also, it's okay. But we got the chance. We are doing it little extra. These are the areas where you can have the nerves burned.
Can you see the catch there?
Yes. Since we.
So yes,
I'm pulling.
resistance is there.
Once we get that catch, we should not push it again, no?
No,
No, we
no,
can
no.
push and
Already done. No.
A small incision.
We can push and see whether it is the,
No.
now it is not going that in.
Okay.
Good only. We are able to treat that vessel.
Initially, it was going in also freely. That freely going in and freely coming out, you can feel. I think when you are putting a stripper in, it goes in freely, right?
Below the ankle.
Below ankle, better not to treat at all. I would say below ankle, because if you do an sclera also, that is the area where cells will go inside, no, to the deeper system. He showed the pictures. Dr. Pai showed the pictures. Now dorsal veins will just go inside. So if you give sclero, maybe few means maybe 0.2 cc or something, it's okay. Still you can try. But if you give little more, it will definitely go into the deeper system. So better to treat above, and you just think it will get better, because anything, all those upper vessels are treated, it will be okay, because these vessels are not part of the varicosity actually as such.
Now what should I do? Can anybody tell me?
Withdraw the cannula.
Yeah,
Yeah,
do,
sheath, not cannula, sheath.
do 1 centimeter withdrawal. Okay.
Scorpions at അഞ്ചാറിന് എടുത്തു ബാൻഡേജ് എടുത്ത് വെച്ചോ. Yeah,
As it says, that part,
Okay.
after making a preparation, only 2 cc to 3 cc.
each area, yeah.
So what is the area which covers approximately?
It may cover a lot of areas which you will assess with an ultrasound. Sometimes it will be like, may not be into a good vessel, which will allow.
Keep out.
Sometimes if you take it here, you can see it's almost like up to knee and all, even if you take it ankle. Yeah. If it's not reaching,
You
then
take it there.
you will have to give another shot
Now
at
give
some other place.
here.
Any questions on laser application? All of you understood how laser is applied? Will safely apply?
Anybody has a problem with the calculation?
Cannulation.
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 Calculation of what?
Calculation of the energy, how much.
They should learn basic mathematics up to 10 into 10.
That is there, sir.
That is all. Nothing more. It is 8 into 8 is 64.
Yeah.
6 into 6 is 36. 4 into 4 is 16.
16.
You have go back to the school days.
Energy is equal to watt into time.
That's where like.
No, I'm just joking. That much only. It's not complex. You think too much, no, then you will not do it all.
And if it is not getting,
phone എടുക്കണേ.
and doctor,
ആരെങ്കിലും phone
if it
എടുക്കണേ.
is not getting blocked with that, you just double it.
Double.
Here 8 into 8. Here 8 into 8.
എടുത്തോ.
Let us do couple of cases.
Here 8 into 8. And then here
Ani-
6 into 6.
Ani
Here
ഏതാ?
4 into 4. Initially I kept 4 into 4.
അതെ
16. It was not happening.
Ah.
Increase to 6 into 6. 36. Now it is happening.
Yeah, actually, they may do it, but if you know it, you can actually guide them and you also understand that what is the energy delivered. But it's like simple mathematics only, squaring some values. Even last actually it was not squaring. He actually increased only the time.
Yeah.
Or he can apply for more time. Second time, one more application. He can withdraw half centimeter.
That's what he said.
Yeah,
Withdraw instead of.
yeah. All those combinations can be done. But only thing you remembered is like if it's near the ankle, it should be lesser energy. Then by its knee, you can increase. Above knee, you can increase further. That only you need to remember. എന്തായി എനിക്ക് താ മോളെ ഫോൺ താ കൊണ്ടുപോയോ എന്ത് പറഞ്ഞേ അല്ല ശരി ഓക്കെ
There is a pause time of 1 second and 1 millisecond. Why is this 1 millisecond? Where we are not able to start? This one. That is a pulse, no? Each no, that is after
that we'll see afterwards. You'll see once this procedure is over. We'll see. Let it finish. By the time next leg is setting, we'll see what is asked.
Cannulation of this spider nail.
Spider veins cannot be cannulated. And that can be done with a scalpel set, and you can give sclerosant. We'll show now. You can see even this area, which was torches, no, it's all like flat now. Understood? After the laser therapy, you will not see those vessels. You're happy.
Can you see? It is now out.
Stand by. Okay.
Have you marked the perforators?
Huh?
Perforators.
Perforators actually was marked earlier, or I'm not sure.
Not marked.
Yeah, may not be that necessary if you're treating the entire vessels. Entire vessels.
No, just in the tip only.
No, that will give it to them. They will clean. No.
It is in the
No.
tip only.
Brother, is there the clean ചെയ്ത് വെക്ക്. That can be actually reused if you are preventing a clot.
Sir, I'm talking about this.
Yeah.
Pause time. We are keeping at 1 second. This 1 millisecond is also there. This pause time. Where we are going to use this? Like no, that usually is kept it every centimeter we are pulling in between. This is the pulse mode, no?
Pulse mode.
Yeah, pulse mode. So that pause time is almost 1 second.
Okay.
It's millisecond, no? Yeah, 1 millisecond.
No, 1 second or like.
No, it is selected.
No, it is just for that accuracy part. They would have kept a
But
thing
we are
like that.
not using that.
We are not
Yeah.
We are
using
not
that.
using. That's what I also.
No need to worry about it.
Okay.
We didn't see that button. ഒരു ലൈറ്റ് ഇങ്ങോട്ട് ഓൺ ചെയ്തേ.
Pulse pause time.
In continuous
കഴിഞ്ഞില്ല,
mode,
കഴിഞ്ഞില്ല.
beep won't be there. So that
ചുരുട്ട് പോയി, ചുരുട്ട്. ഞാൻ പറഞ്ഞ concept.
somebody will have to continuously look there and find out the multiples of 64 or multiples of 36 happening. Okay.
പുതിയത്
out.
എയർ ഔട്ടോ ഒന്നും വേണ്ട 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 ജസ്റ്റ് ഗിവ് ഇറ്റ്. ഇച്ചിരി അങ്ങോട്ട് മൂവ് ചെയ്യാം. ഇവിടെ നിന്ന് പിടിച്ചത്.
ഇത് എടുത്തു വെച്ചോ ബ്രോ.
Don't try to inject any sclero below the angle. Again, I am telling because it can go to the deeper system. Now I am just trying to cannulate some of the vessels.
There is an ulcer already, venous ulcer.
Ah.
Whether we can do laser or whether we'll wait for the venous ulcer to heal, then.
What did we do? It's an ulcer, venous ulcer. We are treating.
Big ulcer.
Big ulcer also you treat. Then only it is going to be actually.
Sometimes the vein will be underneath, going underneath the ulcer.
Yeah, yeah.
Vein.
Now the cannula when we through the ulcer.
So that we can do.
Good.
Because in open surgery, we usually tell we'll heal the ulcer, then we'll do the surgery.
That also is not correct. If you are going to treat it properly, your ulcer will heal. No. Can you see? I just punctured a place. I'm just waiting for the blood to come. Too much of air I don't want. Anyway, already air is there. Little bit air is okay. Done. Can you see another phenomenon? If it is the right place, no, I did not push it. It's just sucking in. That shows it is a right puncture. Means I did not put it, no. So I will show you vessel which is having a sclerosant. Everybody concentrate on that.
Can you see there?
There in the screen.
Yes, sir.
That is what that means. I have injected. Yeah, I did not put too much, no. Just put 2 cc. Just come to some vessel.
Which
This is
butterfly. Which
Can you see?
Huh?
Can you see sclerosant everywhere?
that powder like no scary stay. What is that? Starry. Huh?
Starry sky.
Star.
Yeah, it has gone, this entire way it has gone through.
The 22 gauge.
22 gauge is using. This black one is 22 gauge. It's okay. You can use anything. But we usually use 22 gauge. Don't try
So
to
here there is a big
tell
way.
them open and give. Don't ever. You only do it. Otherwise, they'll give it. You get a prick. Yesterday also I had one. Otherwise, I usually don't ask. Somebody will be too helping. Remove and give it.
ഇല്ല ഇവിടെ ഒരു വലിയൊരു വെയിൻ ഉണ്ട്.
Okay. No. Brother.
In the center of my stone.
And away. Should have a free flow of dye.
No veins are same.
And that's what he fixed. Every time he fixed. Achurda. 3 cc. Okay. You wait for it, it will fill. Otherwise, too much of air will be there. No, you don't want to do that air. I connected. I'm making sure that it is. Kannadi maatayirunnu. I'm sitting like MGR. Can you see it is going in? This particular sign, I will be very happy. Did you see? It's just going in. I did not push. Come see. It's just going in. That means we have done it properly. One second. We remove it and just try to see what Dr. Pai is doing, no? And you can see it just actually a little collapsing also.
Can you see how it was initially and how it is now?
That black color gone and white patches are coming.
As you move the probably it's spreading along also.
Yeah.
So we
Here
will
there was a vein which was prominent. It is there now, even without. There is no sclerosis there.
What Pai is telling is pick that area. Give me cannula. He's telling you missed out. Cannula, the scalpel, bro. Plastic can be taken out. This only I'm telling.
And in the central,
I don't know.
some 1 centimeter deep.
Okay. He gave me 2 clues. Center of the probe, 1 centimeter deep. If I don't listen, then I don't puncture. Give me.
That centimeter you can see marked there. 1, 2, 3, 4. The depth you are seeing in the marking.
More than what this general centimeters.
There is no magic in finding how much centimeter deep it is. It is written there.
But for the person who is pricking to be listening to the person who has shown,
No, they will be thinking how this fellow told 1 centimeter.
1 centimeter is
When-
approximate.
When we are doing in our place, how can we find it is 1 centimeter and then?
Now, in that, it's like see, can you see it's just getting sucked in? I did not touch this one. I'm telling. This area, it is sucking in means I am in the right place. Otherwise, if it's subcutaneous, it will not.
Can you see?
You punctured. See, can you see by the time I did not inject itself, no, that shadowing is coming.
Yeah.
Can you see?
Yes, sir. It's coming now.
I injected.
കുറച്ച് lateral കൊടുക്കണം.
This bigger vein, more chance of
Getting things inside. Yeah.
That's why we are giving some 1 cc, 2 cc, 3 cc like
Small
that.
only. If at all it is going in, it is only small quantity. Doctor, you are
So even if it is a big vein, we should not do.
too much.
Freeze again.
Please, press.
Can you see muscles? Deep
Right
facial
now, I'm
muscles?
going to do that
Can
immediately
you see
because I
vein
don't
in
want
the
it to be
muscle?
layer remaining and it's getting washed.
It doesn't
As soon as
have-
possible, I'll like. That is why
There is no
we do
sclerosis
the
there, right?
ligation. Closure of the upper portion was done. Then only we are doing.
But here it is not there. Here it is there, here it is not there.
Yes, sir.
Wow. ഇനി എവിടെ ഇടുന്നെ?
Sir, a short reference in that.
Sir, we were talking about.
എന്റെ സ്പെക്സ് എടുത്തേക്കോ.
Deep vein varicosity, sir.
So,
How to,
Not deep vein varicose.
No, no.
Deep vein disease.
deep vein of incompetence, something was told.
Deep
Sir,
vein
that-
reflex.
reflex.
That will be elicited on Doppler by a good radiologist.
Sir, how to tell that radiologist, sir, to, means how.
How to-
No, and how to.
no, that
No,
in
that-
during MD days you would have been told. You don't have to tell. That's not right.
I have never seen a report which is telling, having this patient is having deep vein reflux.
You ask him.
He will start avoiding.
Any vessels here?
ഇവിടെയൊക്കെ vein ഉണ്ടായിരുന്നു.
Scalp pain?
Areas also.
Huh? Every time scalp pain because otherwise I will not know whether I punctured or not. You know how much is the cost of this?
The center, 1 centimeter.
20 rupees or something. 10 also you can use. But better than me, not me. Yoda bhai.
Sir,
Instead of chemotherapy, can use laser. What is a laser?
Water vessel.
Water therapy is for the
for spider
Spider
maybe.
Spider veins also there are lasers available now for spider. These are not spider, these are bigger ones. Not really able to locate. I'm not sure. Not able to means because it's halfway that side this side also. വേറെ നോക്കാം ഇവിടെ എങ്ങനെ ഉണ്ടോ നോക്കാം. ഇത് എടുത്തിട്ടേ. We'll see whether. If you are not able to cannulate and get assistance of your anesthesia colleague, they will do it. Other than anesthesia, some surgery also. This is the use of sometimes helping them by putting cannula, all those. Now you can use it for your surgical practice. You should have patience. Wait for it to the air to be flushed out. Brother asked me something. That shall you flush out air and give it to me? But I'm not usually interested that way. He is filling saline and giving. I just want the blood to be coming and pushing every over out. Then I'll connect. This I'm thinking as an easy access to get to that vessel which Pai is showing. Let me see whether something is coming. ഒന്നില്ല ബ്രദർ ഇതെടുത്ത് ഒന്നില്ല ഉണ്ടോ
ഒരു ഇത് തരാമോ എനിക്ക്
സ്കാൽപ്പ് 22.
It's inside.
അത് വന്നിട്ടുണ്ട് തരാം.
Okay, then you push it a little more. That's fine because there's not much of thing. എന്നാ ഇപ്പൊ ഇവിടെ മാത്രം എടുക്കാം. ഇവിടെ മാത്രം എടുക്കാം. വേണ്ട ഒത്തിരി ഇടണ്ട. തന്നെ ബ്രദർ ഒരു സ്കാൽപ്പ് മേളിൽ നിന്ന് ഇടും. മേളിൽ somewhere you put.
Make sure it's compressible. If it is not compressible,
അവിടെ ഉണ്ട് തരാം. അവിടെ ഉണ്ട് അവിടെ
it's not
ഉണ്ട്
compressible, means
ഇവിടെ ഉണ്ടോ?
അവിടെ ഉണ്ട് ദാ.
ഡെപ്തിൽ പോയാലല്ല
ഇല്ല
ഡോക്ടർ യു ആർ സീയിങ് നോ ഇറ്റ്സ് നോട്ട് സീൻ ബിലോ മതിയായിരിക്കും ഇവിടെ വല്ലതും വേണോ just turn oh sorry just can you hold it like that doctor അവിടെ cells ഉണ്ടോ
ഇല്ല ക്ലിയർ ഇല്ല
and after Clearo, do we need to press for some time?
ഇല്ല
Yeah.
അത്രക്കില്ല
it better
കൊളാപ്സ്
better you actually tie that off immediately. Compression bandage is applied faster is better. That's what you asked.
So Clearo should be given at the last part. Okay.
That is why Dr. SN closed that wound also up. You saw that, no? So that we did not try with the other side, no?
Which one?
Short suppiness.
In this station, there is no much dilated veins that way.
No, there is
But by this injection here,
പഞ്ച് മാർക്ക് ചെയ്ത് വെച്ചിട്ടുണ്ട് ക്ലിയർ കൊടുക്കുക
this is all because of the short suppiness, no?
Okay.
We are trying to take it.
With this clear on.
Yeah, it's clear only. Short suppiness, that's why we said it's not easy to get that area. See, it's going in. Without my thing, it's going in. That means it's fine. Can I demonstrate the ultrasound?
For short suppiness, we need not get into.
yeah there is this
There is no need. Unless demonstrable vessels are there, unless demonstrable varicosities are there, you don't have to really think of that area. You can put some sclero in this area, lateral aspect, it will definitely go to that one.
Go
Yeah.
to the short supply.
Short suppiness.
Okay.
So no need of laser.
you can see
laser for
every
short-
vein is having sclero now.
1 second. No? You ask something?
No, no need of laser for.
No,
short-
possible, impossible.
Impossible.
Impossible because these are like very tortuous vessels.
So.
Yeah.
Madi.
മതി sir.
Tie this leg.
Can we use laser for the short suppiness?
That's what we are telling. It may not go. See the course of the vessel. No? It is like this way. It will not go in. Even the long suppiness for this patient is little difficult. Here sometimes we get a vessel by which you can actually go in. Tie.
So two things
ആരായിരുന്നു?
it is not possible.
Huh?
You have this
Normally,
one,
we need to
don't
kill
do
the short
anything at the
suppiness
door.
vein along with the long suppiness.
And
If
two,
it is showing some kind of a reflex, means incompetence there. Otherwise, short suppiness, it's not means it's okay. If you're seeing something in the ankle, lateral malleolar area, if something is dilated, you can just put 2 cc thing and that will take care of that area.
you can give sclero here and you can push the sclero onto the dorsum of the foot.
Yeah.
Don't give sclero on the
VHP,
dorsum of the foot because there is
Namely.
communication between the deep veins and superficial veins.
Tie fast.
Patient here easily it will go into
ഈ പിന്നെ ഇവിടെയും കൂടെ ഒരെണ്ണം ഒട്ടിച്ചേക്കോ ഈ അൾസറിലൂടെ ഒരെണ്ണം ഒട്ടിച്ചേ you can see the collapse of all those major things, no? After the sclero, all those, not like the other side. പെട്ടെന്ന് പെട്ടെന്ന് ഒട്ടിക്ക്.
should put a top.
വിശക്കുന്നില്ലേ ആർക്കും?
That will give it.
എനിക്ക്
So that it will
വിശക്കുന്നുണ്ട്.
not go inside.
Okay, better take, no, that is sclerotherapy alone if you are doing.
Okay.
Once you are combining with the laser, we have
പൈസറെ
diluted here.
പൈസറെ അപ്പുറത്ത് ഇൻസിഷൻ ഇട്ട് ഫാസ്റ്റ്. കൊടുക്കൊടു.
Okay, make sure that and under ultrasound guidance, look whether it is going in also.
പൈസർ അപ്പുറത്ത് ഇൻസിഷൻ ഇട്ട് ഞാൻ ഇപ്പുറത്ത് ഹെൽപ്പ് ചെയ്യാം.
The other thing which you told is somebody who is doing sclerotherapy alone. They will keep the patient in the OPD itself, put a candle in
Ouch.
the leg, push entire sclerosant, and imagine that the entire thing will be taken care with the sclerotherapy. Then all this issue, issues are
പിന്നെ
there.
വാരിങ്സ് ഉണ്ടെന്ന് തോന്നുന്നു.
The bunch
അത് സഫിന വാരിങ്സ് ഉള്ളതാണ്.
And what is the cost of infection? Usually after varicose and sclero.
Okay, give me some space here.
Bandaging maybe for 48 hours. No, it's okay. Bandaging for 48 hours. Then stockings for 2 months. Post-op we will discuss. Only one person has to go early, no?
Yes.
Post-lunch we will sit for half an hour. After this procedure is over, we will sit for half an hour and say what are you doubts you want, like post-operative care, prevention of recurrence, all those. Knife? No, this പൈസർ വന്നില്ലേ അത്?
ഞാൻ സാർ അവിടെ കയറിയത്
അല്ലല്ല
ഞാൻ
ഞാൻ
ഇങ്ങോട്ടേക്ക്
ഇവിടെ ചെയ്യാനാ, ഞാൻ വരാൻ പറഞ്ഞ
Okay.
ചെയ്തു പോയി
Okay.
ചെയ്തോ പൈ ചെയ്തു. ഞാൻ ഇപ്പുറത്ത് വരാൻ പറഞ്ഞേ ഉള്ളൂ.
അല്ല അവിടെ കയറാനുള്ള ബുദ്ധിമുട്ട്.
മേലെയോ വേണ്ടെന്നേ, അതൊന്നും വേണ്ട.
You can see the Mickey Mouse here again.
Mickey Mouse. Who wants to
Can
see
I
Mickey
go?
Mouse?
Can I go there?
Can you see, doctor?
The veins are compressing. Artery is still.
Can you see one roll is remaining? The other two things are opening up.
Light ഇപ്പുറത്തേക്ക് തരണേ.
Well,
Mine confused, sir. Can we do
same thing. No, that doesn't actually go through the power. Two people will put. We finish it in 1 hour. Now, like we are going little slow.
താഴെ
Can you
candle.
show the cannulation?
I will try if possible.
Just also to see.
Light ഇട്ടാക്കാമോ?
Yeah, because these are big vessels. I don't know
No.
whether it will permit.
കമ്പ് താ.
Yeah, okay. 1 second.
ഒരു തമ്പും കൂടി.
It may remain. Okay. Just hold it for me somewhere here.
Okay.
Okay,
Arteries. Retractors.
because this vessel, no, it's like full bunch. It may not permit anything.
Or we cannulate from here, sir. Usually.
Yeah, this I showed, no, from here how to cannulate.
No, that you showed down, sir.
Down.
From up.
No, here also same thing. You see, cannulation is same. Cannulation is same. So much of vessels.
So here in this patient, we can.
Better actually to come from top.
Okay.
Yes.
Non-tube.
ഇത് കണ്ടോ പൈ?
Non-tube some.
ഇത് ഒരു മിനിറ്റ് കണ്ടോ? See? So much of tortuosity, better not to cannulate from here, no? I can put a needle, but it will not go in.
Sir, if you do, you can just show them the steps, sir.
Okay, give me a puncture needle.
Some patients will come only with varicosity here. Then that case will just.
Even if you treat up, it will get corrected.
Only tourniquet and all.
No. If you treat the upper portion, this one will go. I'm just trying to put a vessel, decent vessel, rather than the bunch. I'm just trying to do. Sheet, in the did sheet it. എനിക്ക് പെട്ടെന്താ എനിക്ക് എന്റെ ഇതാ പിന്നെ
Guide wire.
ഗൈഡ് വയർ പെട്ടെന്താ വെക്ക് ഏതാ ദിസ് ഇസ് സോഫ്റ്റ് എൻഡ് കർവ് ചെയ്തൊക്കെ ഇരിക്കുന്ന വേറെ തന്നെ ഗൈഡ് വയർ വേറെ തന്നെ
Sir, another question is, we can use this, but guide wire will not get now, sir. We have to take one more set of them.
This guy, where you can use now. So many cases. I told no. It's not a good vessel, but I can use this for,
Okay.
may not be for even sclero. Not going.
Wait, after that. What's it doing?
Bound to fail like we punctured. I don't want to do that because see, this is a bunch of vessel, it's not single vessel. Any vessel only you can puncture. You are seeing a conglomeration of vessels, you should not puncture. You will not go through any of those. We can actually reserve these areas for putting sclero. Just leave that, doctor. You can see those. No. Let us see some vessel, it may be coming from top. When
Not sure
this
whether-
area, we just try and see. If any area, single vessel, you can try.
Give me a Alice or something.
Nothing on the lateral aspect. You are asking about short surface, no? Nothing in this area. Only this medial malleolar area. But here it is too much. But 70% of the issue will be taken care by your saphenofemoral ligation. Then another 20% by your ablation of that vessel. Then sclero. So 99% I tell patients by my triple therapy.
Sir, if you are doing from upside down,
Yeah.
and if you are coming till here, then usually this distal vein will get compressed or
Yeah,
obliterated. no, sir.
mostly.
Then before obliterating that vein, then we have to put a cannula here and then only we have to do it, or how it is.
Which one? For sclero?
No, for laser.
No,
You did
laser usually up to here also it is fine for you if you are doing from top and you are not getting any access from below. Up to here it's okay. We tried once more to demonstrate and it worked. It worked, that's all.
No, my question is, sir, we do laser till here.
There is
Hmm.
one more.
Then are we able to cannulate here? Because this vein will get.
That's why
compressed,
you
will
want
collapse.
to try cannulation for a laser, you do it early
Okay.
before treating.
Before treating, then we'll put.
He's
one
telling it will be
cannula here.
collapsed. No, then you may not get an access. That's fine. If you are trying to do that, it's okay. If you are trying from that itself, it's better you do it.
Okay.
Demonstrate it how much it is. That's so huge a vessel. Just see for a minute. Then we'll do what all extent it's coming. It's huge vessels, something called as saphina varix. No, entire area is like bulged out, popping out. I don't know why people keep it for so long. We can see at in between segments and all. This is like unlimited. By nallona hold ചെയ്യണേ 2 times hold ചെയ്തിട്ട് ചെയ്യേ. Don't avulse it also. Pull out ചെയ്യല്ലോ. Any incision ഇട്ടാലും കുഴപ്പമില്ല. Where is my chair? Okay.
Get a.
This is something you should not do it single-handed. One more person to help you. This, this sclero is going to be really helpful for you if already vein has been treated with laser or a ligation, open procedures earlier, all those retinal stripping has been done. Then sclero may be the only thing which is possible. Ara? അടുത്ത നീത ആരാ
Bipolar.
ഹലോ നമസ്കാരം പറഞ്ഞാട്ടെ പറഞ്ഞാട്ടെ ഞാൻ തിയേറ്ററിലായിരുന്നേ ഓപ്പറേഷൻ തിയേറ്ററിലാ പറഞ്ഞാട്ടെ അല്ല പറഞ്ഞോട്ടെ ഞാൻ കുഴപ്പമില്ല ഒരാൾ ഹോൾഡ് ചെയ്യുക ഫോണാ Yeah.
So what are the reactions?
The defects are very much dilated, right?
Sclerotherapy, yeah. Sclero, all of you are listening, no?
Artery.
Sclero actually, you should warn the patient, especially when there is that, what is that C? Grade 4C and all he showed, no? Multiple, that vessels are popping out, about to rupture. Those things may turn out to be an ulcer itself when you give the sclero, because it's already thinned out. It may ulcerate and then only heal. You should tell patient maybe small area of ulcer will come, but it will settle in few weeks time. Sometimes in that cases, it may. These all bigger vessels will go for occlusion only, but these may ulcerate and then only heal.
With the very thin skin.
Yeah, very thin skin, especially those small pimple-like lesions. No, those will go in for a ulceration and then only heal.
Any reactions?
Reaction as such may not be there, but we had one patient when the sclero was going in, the pulse rate, everything was taking actually a little bit of changes in the BP pulse was seen when little more of an extra sclero was going in. We immediately gave heparin. Arrhythmias possible. Arrhythmias possible with sclero larger amount. So that time onwards, we are very careful. We don't give in too much of thing. 2-3 cc only injected. ഈ ഇടയ്ക്കുള്ള സ്ഥലം ഒന്ന് അഴുക്കൊന്ന് കവർ ചെയ്തു അതൊക്കെ ഇതൊക്കെ മാറ്റി വഴിയിലിട്ടേക്കാതെ ആ അല്ല അവിടെ ചെയ്തോണ്ടിരിക്കാം ഓക്കെ പിടിച്ചു ഇതെല്ലാം സ്റ്റെറൈലല്ലേ
Okay. Now it is flush, right?
Fiber is getting compressed, doctor. Fiber is getting compressed. Be careful. Laser fiber, be careful.
Cycle 20. If this goes, it will
Once this laser fiber was inside and we thought it may be a
have all stuff.
vessel which is thrombosed, hooked and excised. Probe into 2 pieces. Many things you have done. So why I'm telling my foolery is you people should not repeat. Because it was not accessing one area, then we thought the cannulation is from another area and this is another vessel. But it was actually the vessel with the fiber, radial fiber inside, we excised it.
മനസ്സിലായില്ല രണ്ടും കൂടെ ഒരെണ്ണത്തിന്റെ
Some people use 50 cc syringe alternatively for this 2%.
Yeah.
Like, which one did you find easy? This one or?
No, to inject it maybe smaller quantity multiple times is better. We usually use that also only. Maybe if you find they are doing it a little more with ease, you can follow that. I'm not sure. Somebody want to see the ice, no? How it is prepared?
Lower one.
Who wanted to see the ice being transferred to a gloves? Just see.
എടുത്തോ
എന്റെ ഗ്ലൗസിന് ആരും ഇല്ലല്ലോ ഇത് ഇങ്ങനെയാ ചെയ്തിരുന്നത് വെള്ളം ഒഴിച്ച് കെട്ടി വെച്ചിരുന്നു See what they have done is in a sterile gloves sterile ആയിരുന്നോ അല്ല in a sterile glove they have taken saline and it was kept in the fridge so the outer area is unsterile. So what she is trying to do is putting that unsterile one which is she has taken into a glove. Various tricks they have. Otherwise, they actually take that, break it into pieces, put it in a kidney tray, and fill it into this. That also is possible. Yeah, with hammer only. With hammer only. Orthopedic one instrument is taken on rent.
What surgery you are doing?
Yeah, they will take that hammer on rent and then do it.
ആട്ടെ artery. Just this needle holder is not holding.
This,
Why we were telling about triple
Jelly
therapy
on-
repeatedly, usually what radiology person who is doing, they will do only laser. There are some very easy guys who will do only sclero, and some are adamant that I will do only stripping. All three actually to be learned. So radiologists cannot learn that surgical part. So it's better for us to actually learn bit of sclero, more of laser, and one procedure saphenofemoral flush ligation. So combination of it so that you make it least invasive but most effective.
How to prepare that probe with jelly, some kind of short answer.
Hmm?
That probe, they have put some jelly and.
Yeah, that he will show once he is untying it. താഴെ കെട്ടിയായിരുന്നു അവ
അവിടെ കെട്ടണം.
കെട്ടിയിട്ട് cannulation. I don't know how it is going to come down. Pray and put it.
Sir, can you just keep the tartar like that and probe?
Before laser and sclero, no, we used to always put incision and excise.
Wait.
Especially in areas where there is dermatosclerosis, no, if you put an incision, that itself will be a non-healing ulcer.
അതല്ല cannula ഇട്ടിട്ട് കെട്ടിയാ പോരെ.
അല്ലല്ല അപ്പൊ ഈ കെട്ടിയിട്ട് cannula ആയിട്ട് ഇട്ടാ മതി.
അതല്ല
Puncture.
cannula താഴെ പങ്ക്ചർ ചെയ്തിട്ടിട്ട് മേളിൽ കെട്ടിയാ പോരെ.
ആ മതി 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 ദാറ്റ് ഇസ് ഫൈൻ.
കാരണം അത്രയും നമുക്ക് താഴെ പോവുകയല്ലേ ചെയ്യുന്നത്.
അതെ അതെ
ഇതിപ്പോ ഇവിടെ ബൾജായി നിപ്പുണ്ട്.
അതിനെ ബൾജാക്കിയാലേ cannula ഇടാൻ പറ്റത്തുള്ളൂ. അതിനെ ഒന്ന് ല്യൂമിനെ ബൾജ് ചെയ്യിപ്പിക്കും.
നമുക്ക് അപ്പുറത്താക്കുന്നുണ്ട്. ഇത് ആൻട്രോ ലാറ്ററൽ ആണ്, ഇത്
നോക്കിക്കോ.
പോസ്ട്രോ മീഡിയൽ ആണ്, നടുക്കാണ് സഫ്നസ്. യു ക്യാൻ പങ്ക്ചർ ഇൻ ദ ബൾജ്. യു ക്യാൻ പങ്ക്ചർ ഇൻ ദ ബൾജ്. ഇപ്പുറത്തെ ഡയറക്ഷൻ അല്ല, ഡയറക്ഷൻ ഷുഡ് ബി ദാറ്റ്.
ആ ഡോക്ടറിന് സർട്ടിഫിക്കറ്റ് കൊടുക്കാൻ സാറിനോടൊന്ന് പറഞ്ഞു.
ഞാനിപ്പോ വരാം. ഒരു സർട്ടിഫിക്കറ്റ് കൊടുത്തിട്ട് തിരിച്ചു വരാം. You try your luck reaching this area. Otherwise, I'll come for sclero. Easier job is sclero, no? Yeah.
ഇതിട്ട് നോക്ക.
This coming from outside.
You can put the other end, no issues.
Can we get this guide wire separately, sir? Because at times, both tips will damage.
പോകുന്നില്ല അപ്പുറത്ത്. ഷീറ്റിട്ട് നോക്കുക. ഇപ്പുറത്ത് നിൽക്കാം. മുമ്പത്തെ ഷീറ്റ് ഉണ്ടായിരുന്നു, മുമ്പത്തെ ഗൈഡ് പറഞ്ഞായിരുന്നു. ഇപ്പുറത്ത് ഇവിടെ ഫസ്റ്റ്
20 gauge lead up. This is a 6 French sheet.
ഇവിടെ ഒരു ആർട്ടറി എന്തെങ്കിലും ഹെൽത്തിൽ ഒന്ന് ഇതാക്കി തരാം. കീപ്പിംഗ് എ ഷാർപ്പ് there. ഇവിടെ കാണിച്ചിട്ടുണ്ട്. ഇത് ജസ്റ്റ് ബൾജ് ആയിരുന്നു അവിടെ. Now it is straight. This is the way. Needle. മറ്റേ കേടോടെ Can you see? I think I have entered, right? Can you see?
Oh, double puncture.
Double puncture. Yeah, it is not double puncture now. Also, smoke. നോക്കണം ഇത് നോക്കണോ? ഇട്ട് നോക്കിക്കാം. കിട്ടുമ്പോൾ കേട്ടോ, കുഴപ്പമില്ല, ഇട്ട് നോക്കിക്കാം. എടുത്തോ. നീഡില് നീഡില് നമ്പർ 11 ബ്ലേഡ്. ചെറിയ നെക്ക്.
Somewhere, anywhere.
Yes, that's coming. Laser probe. Top light off. Light on ആക്കാവോ ലേസറിന്റെ? ഇത് പോയി കഴിഞ്ഞു. അകത്താണെന്ന് ലേസറിന്റെ ലൈറ്റ് ഓൺ. കുഴപ്പമില്ല. മറ്റേത് ചുറ്റി വെക്കണം.
Cover this area of yellow color areas.
Light off.
Brother, cover that area which is dirty. Be careful, don't damage the fiber.
തിരിച്ചുള്ളതായ
ഈ ഫൈബർ ഒടിയും കേട്ടോ ബ്രദറെ. പിന്നെ ഞാൻ എന്തെങ്കിലും പറയുമ്പോൾ പിന്നെ എൻ്റെ അടുത്ത് വിഷമിച്ചിട്ട് കാര്യമില്ല. യു ആർ ഡൂയിങ് റോങ് തിങ്സ് റിപ്പീറ്റഡ്ലി. ആ വരുന്നില്ലേ പൈ?
ഇല്ല, താഴേക്ക് ചെല്ലുന്നില്ല.
പുറത്തോട്ട് മെഷീൻ നീക്കി വെക്കൂ.
That is vein, right? Collapsing vein അല്ലേ അത്?
പിടിച്ചോണ്ട് നിന്നാ മതി, കുഴപ്പമില്ല. പിടിച്ചോണ്ടിരിക്കും കുറച്ചു നേരം. ഒടിഞ്ഞ ബ്രദറിന്റെ റെസ്പോൺസിബിലിറ്റി. ഞാൻ വാഷ് ചെയ്യണവേ. നോക്കാം. ഇവിടെ 2 വെസൽ ഉണ്ടായിരുന്നില്ലേ? ഓൺലി 1 വെസൽ.
അല്ല, ഒരെണ്ണം ലാറ്ററലി ഉണ്ട്.
Try with that. another fiber, no, you try to cannulate through that.
ഇത് കറക്റ്റ് ബഞ്ചിലോട്ട് പോകുന്നുണ്ട്, പക്ഷെ അവിടെ വെച്ച് നിന്ന് പോവാ ബഞ്ച് ആയതുകൊണ്ട്.
That's okay only. You can even exercise that bunch and then bring it down also. But it comes to another bunch, no?
ഒന്ന് ടോപ്പ് ലൈറ്റ് ഇട്ട്
Light on.
ഇവിടെ ഒരു കെട്ട് കെട്ടിക്ക്.
See, what we can do in that case is
Adilo
like
okay.
give sclero in those areas and that's it. Better. Ligation is done, no? Rest is sclero also is okay.
ഒരു കെട്ട് കെട്ടിക്ക് ഇവിടെ. ഇല്ല, പക്ഷെ ഞാനിപ്പോ അടുത്തൊരു കാനിൽ ഇടാൻ പോകുമ്പോ ഇത് ബ്ലീഡ് ചെയ്യത്തില്ല എല്ലാം കൂടി. ഇത് കെട്ടിക്ക്.
Like, can you tell your plan loudly so that we'll all understand?
No, sir. Rasan asked, it is small, so why should we ligate? I told we have to ligate, otherwise when I am going to cannulate the other one,
It may come out, okay.
this may bleed.
I'll do one thing. I'll just have lunch and come.
Okay, sir.
By the time you try 2 vessels. If not, I'll try from something from below or exercise that segment.
അടുത്ത ഷീറ്റ്. Cannulate from inside. I think this may not work.
Mosquito.
This may be the postromedial. This may be the
Medial reporting.
yeah, tributary. Sheath.
Burning that somehow,
ഇത് വേണ്ട.
ablating that.
Blackish
Yeah,
not needed.
it's dilated, so we are putting directly the sheath into it.
That artery, mosquito, please remove.
Sir, how we come to know that that is also dilated?
This is big, no?
If our radial is will come.
No, we can see with our eyes, no?
Okay.
It's dilated.
No, not like this. You told at times there will be some tributaries which will be connecting the short surface with the long
Yeah, yeah.
surface. That how to know?
Open and see.
Because we'll not
And
be
the-
scanning in that area also.
Ultrasound, what we are doing, we can see, no?
വേറൊരു ഇത് ഇത് ലൈറ്റ് ഇതിലാണ്.
അല്ല, അത് കെട്ടാം, അത് കെട്ടാം.
So where can we learn this ultrasound?
It's simple
method?
thing.
No?
It's not big thing, we just want to.
ലൈറ്റ് ഓൺ ആക്കി ഇതിന്റെ.
ഇതിന്റെ ലൈറ്റ് മാറ്റി കുത്തിക്കേ.
Send out and show what you can. Light off.
Top light off.
Top light.
ലൈറ്റ് ഓൺ ആയോ? ലൈറ്റ് ഓൺ ആയില്ല. സെറ്റിംഗ് ഒന്നുമില്ല, ജസ്റ്റ് ലൈറ്റ് മാത്രം.
I think this is the main way, sir. This is the GSV. The way it is coming.
Yeah, this is the GSV.
It's going.
Never judge with the size.
So. No, that area also it's soft here only.
In all of you know Malayalam? I think he can translate. There is some Bible word. മുട്ടുവിൻ തുറക്കപ്പെടും. What is that?
You knock the door.
Once you knock the door, it will open. Likewise, when the valves come, just it will open and you can
Top light
go.
on.
That moment you saw what I am doing, where it is blocking. It is going in, right?
Get on.
Get together.
We are going to burn above the medial malleus.
Yeah.
Yeah. Huh? This will be the accessory, which is dilated. It is Safina varix. So that anteromedial branch was dilated and GSP was almost normal size.
Shall I try to do some stuff now?
No,
You will try.
salt also is down there. But that bunch is caused by the accessory ones.
I think we will have to stay that side. Only then we will be able to see the ultrasound. This is sufficient.
It's not, it's not too much torches, no. Those can maybe it's better. Otherwise,
There is an easy way of doing this without this gloves and all, which I will when I unscrub, I will show you.
just like two bits from there. No? You know, but then severe like what about the scores? Very much
Yeah.
Very easy to.
I don't want the longer needle. Half brown needle. 26 half.
26 half needle. 26 half.
Because here I think I don't want to go like this, because each place will puncture and put there, like that will go.
First you have to take from the Sapana junction to downwards.
we are doing
So
the
just
opposite way now.
imagine
Last
this
case we
patient
did,
develops an ulcer here while during surgery. If we don't use ultrasound, what we will think is that is the culprit. Safina varix is the culprit.
Yes.
We will ligate that. Finally, will the ulcer heal?
No.
No, that is one point which we want to always stress. What is the culprit? We have to map out
We can do
in the
this.
leg when the ulcer is there or some diseases are there. That venous mapping should be done. Can you see small bunches marked?
Can do this.
Dr. Rasan made the patient stand and marked it.
He will stay like that only.
Right. That is very important. So we will take care of all those dilated veins.
Okay.
So even if we miss that smaller one, we'll catch that one at here, at this point here. So that mapping should be perfect. That is what is called anatomical classification. Which veins are involved? Great saphenous, short saphenous, posterior marginal arch vein, posterior arch vein, anterior arch vein, medial, lateral, all those tributaries, which all tributaries are involved. That is very important. Knowing them and tackling them is very important. Hit your needle.
Thing is, at times the vein will be very thin. Means we will be treating it as multiple incompetent perforators. But GSV will not be that thick caliber. Then our probe will not go easily. No? Our probe will not go easily. No, we cannot cannulate that. Or we cannulate any small caliber GSV also. We can.
Which is bigger than the probe, we can.
That's what, sir.
Smaller
So-
than the probe, we cannot.
That's what.
That small GSV, just ligate it, stop it there and put a sclero, that will be sufficient, right? Because it is very small.
Okay.
I have made it very small because this is very close to the skin and the larger one will cause confusion for me, right?
Okay.
Okay. Aspirate. Yeah, aspirate. Aspirate. Blood is not coming. Push. You are sure I am not inside? Madhi, stop. Aspirate. Can you see? Around the vein it is, yeah. Okay, stop. Yeah. Can you see the tip of the needle? Yeah. Aspirate. Oh. ഇല്ല 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 കാരണം ഇവിടെ ഭയങ്കര ക്ലോസ് ആണ് ഞാനിത് ചെയ്യുമ്പോൾ ഇവിടെ ഇതൊന്നും വെക്കാൻ പറ്റില്ല അല്ലെങ്കിൽ ഒരു കാര്യം ചെയ്തോ മേളത്തെ മറ്റേത് ചെയ്തോ that you finish off because their sclerosant is not needed, just ice is sufficient. ഇത് മാറ്റി കണക്ട് ചെയ്യാം ലൈറ്റ് കണക്ട് yellow, that is centimeters.
Chocolate of your.
Can you see the vein now? Freeze, 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 freeze.
What light? Baki light off there.
Yeah.
Light off your. Light on your. Light on out. Okay. Chocolate on. Chocolate on.
The needle is
8
the, can you see the needle? Yeah, aspirate. Okay, now it is near the vein. Push. Okay. Push. Vein is there. No, still above. No, below. No, you don't touch. The other person will touch. You touch the screen. Somebody else touch the screen.
Touch the screen.
Touch anywhere you want. You don't move. Stay there. Yeah, that is the probe. Okay. Okay. Stop, sister. Can you see the probe now? Yeah, once this person is pressed, that's good. Push. Okay, fine. Stop, sister. Give me a longer time. Here, precision was needed a lot. That is why I was using that smaller.
9 seconds again. Ready? Compression. Ice something.
No, while he's not doing here. He is doing the thigh one.
Okay.
I was just.
So we should not press too much on this probe. Or, means once,
No, but we can see the
wire already.
wire, we can see, right? Keeping it in the center. Always there is some, this,
Marking.
can you feel here, there is a small marking, which is absent there.
Yeah.
That is to be kept at one side,
Okay.
this side. Otherwise, what will happen is, just imagine,
Mirror image.
yeah. Now, I am seeing the thing. Okay, I am seeing more that side. So to bring it medially, I should move this here, but it is going outside.
Sir, artery.
So instead, if I keep it in this way, can you see it now?
Yes, sir.
Yeah, now it is that side. To bring it this side, my movement is, it is
Same
moving, it is moving in the direction which I am thinking of. The other was a mirror image. So that thing, this holding the probe this way and that way, you should be very cautious about. Longer cannula. Yes.
The lateral ones?
Yes.
Great. That's good to know.
So where is the vein?
It is in the center.
Almost half a centimeter.
Yeah. Now, as you told, I will keep it this way. This is
the screen. Clean or
okay,
being dirty.
right?
Okay.
Yeah. Can you see my needle
Yes. Yeah.
coming? Aspirate,
Aspirating.
push.
Pushing. Going down.
Yeah, I am more deeper. Stop. Aspirate,
Aspirating.
push. Okay, I gradually pulled that out. Stop. Stop. Again. Okay. Aspirate,
Aspirating. Pushing. Aspirating.
push.
Pushing.
Okay.
Yes. Now that's.
Push that entire length, let it go.
Now longitudinally you are keeping.
Yeah. It creates a bit of ease. Okay, pushed. Entire thing is pushed.
No. NCC.
Okay. Now we'll go about still. Okay. Okay. Take the needle. Okay. Go very close to the probe, but don't puncture the probe.
Okay. No, sir. No.
Okay.
No.
Yeah, there, right?
Yes.
Aspirate.
Aspirating. Aspirating.
Is there blood? Blood. Check here.
Okay.
It is not, right? Push.
Pushing.
He pushed a bit of air.
Sir, that's the blood.
That is there. Okay, fine. Huh? Because what happened, because I told check blood. I just asked you to check it, but you got a reflex that blood is coming here. You pulled it out. At that time, he was aspirating. What was happening was a bit of air was aspirated in, and so that air which in. That is why that's clear, like appearance is there, right?
So nothing to worry about.
What to worry about? Okay. Now, okay, one more. Okay, poke. Straight, yeah.
ഫയർ ചെയ്യാൻ റെഡിയാണോ?
Aspirate. Aspirate, you have to look here.
Okay.
ഇവിടെ clean ആക്കാം.
Push.
Varicose.
But air is coming in. For some reason, air is coming in.
ഇതൊക്കെ മാറ്റിയേക്കാം.
Push ചെയ്തോ? കുറച്ചുകൂടി push ചെയ്ത്.
ഓക്കെ, വേറൊരു ബോസ് വരാമോ?
സിസ്റ്റർ ആരാ സിസ്റ്റർ എന്ന് വിളിക്കുന്നത്? ഓക്കെ, സ്റ്റോപ്പ്. Can you see that? Can you see that? Okay. In this direction. Yeah.
You're going down now.
Okay. Aspirate.
Aspirate, is it? Aspirate. Pushing.
Push.
Pushing.
ലൈറ്റ് മാറ്റി കുത്തിയോ?
No, it's deep to the vein.
എന്റെ ഫോണാണോ സംസാരിക്കുന്നത്?
No, it's deep to the.
സാറേ,
പത്മനാഭ
ഓക്കെ ഓക്കെ. അല്ല, എന്റെ കോള് വന്നതാണോ സംസാരിക്കുന്നതാണെങ്കിൽ സാറിന്റെ കൈ കൊടുക്കാൻ ഞാൻ ഉദ്ദേശിച്ചത്. അതല്ല, ഞാൻ പെട്ടെന്ന് ആരോ പേഷ്യന്റ് സംസാരിക്കുന്ന പോലെ തോന്നി. പിന്നെ രസം പറഞ്ഞു സാറിന്റെ ഫോണിലാന്ന് പറഞ്ഞു.
ഈ ലേസർ ഫൈബർ വെച്ചിട്ട്
No, just look here. Why you made this much? Right, that much is not needed, right?
Yes.
സാറേ ആക്ടിവേറ്റ് ചെയ്യാറായില്ലേ?
Activate ചെയ്യാം, right?
ലൈറ്റ് മാറ്റിയോ? 4 സെറ്റ് ചെയ്ത് ലൈറ്റ് ഒന്ന് സ്റ്റാർട്ടിങ് കാണിക്കോ?
ഈ ഫൈബർ ആവശ്യം തിരിച്ചു കൊടുക്കാം.
പുറത്ത് കൊടുക്കാനെങ്കിൽ റെഡിയല്ലേ? ഐസ് എവിടെ വെക്കാം?
Can we see?
ഓക്കെ അല്ലേ? കണക്ട് ചെയ്തു.
Okay.
Going down.
No.
Aspirate. Push.
Pushing the bread also.
Just see here.
Blood is coming.
Just see here. Just see.
സാറിന്റെ ഇപ്പോഴത്തെ
Okay, stop. Pour out.
ഫൈബർ
Okay. Let that blood staining go.
You are unsterile now. You need to change your clothes.
Just wait. അത്രയും മതിയോ?
അവിടുന്ന് റിലീസ് ചെയ്യണം.
ഇങ്ങോട്ട് പോ.
Four, sir. Four. Somebody hold ice there. I think.
Freeze twice.
Four line. Yes. You are using 147 laser, okay?
Can you see that fiber?
Yes, sir.
Because sheets and fiber should not be confused, right?
Ready, huh? Laser machine ready, huh?
Ready, sir. Ready to.
Ice, who is putting?
Can you see something now? My hand has changed. So the needle is coming from the opposite side. Right.
Yes.
Aspirate.
Blood is
You put. Okay. Aspirate.
Ready.
aspirating.
Push.
Going down.
It is not going down, it is going up. My-
Vein is going up, sir.
Yeah,
Oh.
my probe is this way. Now it is
Perfect. That's good.
going up. Okay. Right. Stop.
Once a minute. This one once a minute. Now it's actually
Okay. Just let me cross this. Yeah. Aspirate.
Aspirating.
Ah.
Aspirating.
Ice
Push.
position നോക്കണേ.
Pushing.
What is this one? This one?
This one, marking, no? Centimeters it is showing, see.
7 or 70.
Yeah.
The whole length of the.
Ice melota atne. Ice up.
Okay. Aspirate. Ah, push.
Just see, now it is there. Try to push in this one going down. Very much it's not really going.
Okay.
Means it is
Not because I have removed the probe from there. That is why. You can see that needle. You can see the
Going down.
vein also.
To pull out.
Okay. That is fine. Stop.
After this one.
The coverage. Here it is not that superficial. Okay. The edema will develop.
Yeah. Got it?
No need.
Next one, this way, Activate again.
You are controlling input for it.
Yeah, I know. Now pull.
Some.
That is the catch. Next one.
I will hold this. You can go ahead and. Behind somebody wants to remove this, you can ask them to remove it. So you can have a feel of it.
Yes, activating again.
ഇതൊന്ന് ഡ്രിപ്പ് സെറ്റ് ഒന്ന് മാറ്റി കൊടുക്കണം. You can go towards the head.
That is.
But then that vein is getting.
No, this side. Rotate and go this side. Behind the mirror.
So, others.
ഒരാള് കൂടിയുണ്ട്.
Not that much. Maybe mid increase
Mid leg.
mid leg 6
Power is not enough.
power is not enough. If you're not getting the case, we need to increase.
Done.
Okay.
Actually,
Yeah.
Brothers clear എടുത്തോ.
Next one. So if we get too much of it.
മിക്സ് ചെയ്യുന്നത് ഇത് കഴിയുമ്പോഴേക്കും ചെയ്യാതെ. ഇല്ല ഇപ്പോഴല്ല, അതവിടെ ഇരിക്കട്ടെ. മിക്സ് ചെയ്യുന്നത് കുറച്ച് കഴിയുമ്പോൾ ചെയ്യാം. അവിടെ എടുത്തു വെച്ചാൽ മതി, ലോഡ് ചെയ്ത് വെച്ചാൽ മതി.
ആൾറെഡി കുറച്ച് ഇരിപ്പുണ്ട് നേരത്തെ ബാക്കി കുറച്ച് 3cc ഉണ്ട്. 3cc ബാക്കി ഇരിപ്പുണ്ട്.
3 തികയത്തില്ല, ഇനി എടുത്തു വെക്കാൻ പറഞ്ഞു.
പ്രിപ്പയർ ചെയ്ത് വെക്കാം. ലോഡ് ചെയ്ത് തരാം. ഫിനിഷ് ചെയ്തിട്ട് മൊത്തം ലോഡ് ചെയ്ത്
145 only.
That is the energy delivery.
എനർജി അതാണ് ടോട്ടൽ എനർജി.
Total energy.
Forgot it. There is the gas. Not the round. We are just pulling that from. That is adding up. I will make some.
So if the pulse mode is not there, somebody has to look at the multiples of 36 they have to do and tell you, yeah, now it is done, pull out, now it is done, pull out. But as it is pulse mode, it will give a beep and you will pull it out.
Adding that.
There'll be a small break at that point. The energy will be delivered as a pulse with a small break, and that break will be marked as a beep. So you can pull it out. The continuous mode means it is continuous. There is no pulsation there. That is the difference between the continuous mode and pulse mode.
For varicose, we have to use only pulse mode, right? Continuous.
This one is pulse basically.
If I am using continuous mode, I will make the person who is laser guy sitting here with multiples of 36 written in a paper in his hand and look in the thing, and now multiplies happen, pull out, multiplies happen, pull out. Is it practical?
If you are
Huh?
angry with the laser guy, we have to do that.
No, he asked me, can I do it? That is why I answered so. ഇല്ല താഴെയാ.
You need to take care of this one, because patient is concerned about.
Yeah, sclero അടിക്കാം.
You know. Will take lot of preparation. Free of.
Now the same thing.
Tell to mark them twice.
Now same procedure. Just imagine you are doing in an OPD under local anesthesia.
Very difficult.
It's very difficult for you and strenuous for you, right? High.
Already, yeah, documents where all the work papers are there. You can just mark it. If it is a different person, you will ask for.
Okay, somebody take care. മുട്ട് കഴിഞ്ഞ്.
I think
This
now
fiber
the
should not
current
get
also
damaged.
it's CC. So increase it.
ഇവിടെ ലൈറ്റ് വരണേ. ക്ലിയർ ആക്കാം.
8.
May get the ultrasound this side.
Done, sir. Ready? Ready.
Is the power universal for all machines or individual machines?
Power for varicose is
Free
Yes, sir.
price.
but this now. Now the
Yeah, 16 that is.
They are not getting batch, we have to improve that.
means it is not.
Yeah,
quite
it is very difficult for us to appreciate which is vein and which is our water. Can you see? Water is also seen there. Here it is water is seen, right? But on collapse, on pressure, the water doesn't collapse.
Sorry, sir.
But this vein
22.
collapses, right?
Great. Great.
It's a water will not collapse, but rain will.
Vein collapse. Okay, there is a big vein here.
Yeah. It is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now it is 4, means 41 centimeters. Now 30 more is there. Light on off here. Light off, please. Other light also.
ഉള്ള
Huh?
അല്ല അവരവിടെ നോക്കട്ടെ ഒന്ന് ലൈറ്റ് ഓഫ് ചെയ്ത്
Light off. Yeah, okay.
ഒന്ന് കൂടി ഓൺ ചെയ്ത്
Light on.
ഇങ്ങോട്ട് വെച്ചോ ലൈറ്റ് ലൈറ്റ് ഇങ്ങോട്ട് താഴോട്ട് വെക്കും
Light.
Set up. താഴോട്ട് ഈ ഭാഗത്ത് ബ്ലഡ് വന്നിട്ട് ഫുള്ള്
Plus now. Still what we can do. 8 or 9 maximum. Round is not passing.
അടുത്ത സെറ്റോള് പൊട്ടിച്ച് വെക്കണേ.
We will try half. So let's 72 ആക്കണേ.
കണക്ട്
72.
it is sucking in, right? Push. Slowly push.
After 9 it will become 2.
Okay, I am removing it.
After
Give me a mop. Give me a mop.
second 4. Wondering about the.
Can you see that sclero?
Yes, sir.
Yes, sir,
Okay.
that white color.
It is going this entire way up. This region, everything is sclero is there.
Yeah.
It has gone.
But not as.
Okay.
Yes, sir.
Here there was a bunch. Is there sclero in that bunch?
Should be perfectly. I mean.
Already the sclero has
Scleros.
reached the bunch,
Yes, sir.
right?
Yes.
No need to do so.
3 ml is covered to
And
to cover
can you
this much.
see
Yes,
deep fascia? White,
yes, sir. 2 white.
Light on off here.
a bit of sclero is
Light off.
going
light off.
deeper. Can you appreciate?
Yes, sir.
So no need to give more sclero in the
Okay.
this side.
Yes, sir.
Some slow is there, but not very.
It is already there.
Yes, sir.
Huh?
Yeah, it's here.
Done. So
Like
this
now?
medial part is fully taken care. Now no need to do more there. Let me see the dorsum.
That much length of.
Here all sclero is there.
Yes.
right? You were worried about dorsal venous things, right? But can you appreciate sclero now there?
Yes, sir.
Yeah. Now we want to see the left side. Mix ചെയ്തോ അടുത്തത്.
This external compression also matters. Because that will make the and five vessels approximate. So that helps.
There are few veins here, right? So 1, 2, 3, and fourth will be the thigh one. Mouth. Okay, I can feel a vein here. That bevel is up.
Hemorrhoids. I'm not getting this kind of crackling sound, even for grade 3, grade 4, but they used to do.
It's the vessels are small.
Blood is.
We have to study about all five elements.
But when others were doing,
Brother?
I used to hear. Oh, I was wondering by the time this is
Just 2 cc.
But they used big one.
ಇಲ್ಲ ഒന്ന് ബ്ലഡ് ഫുൾ വരട്ടെ.
Not such complex stuff. Light off.
Later.
ജസ്റ്റ് ഒരു വെയിലൊന്ന് കുത്തിയിട്ട് മതി.
Blood to come out.
Yeah.
Somewhere here.
Connect. Connect. Push.
Let's aspirate it. Pushing it.
Stop.
Light off here.
Hmm.
Stop light off. Pressure on the blessing.
Here, sir.
Light on. Light on.
Hmm.
So we are close to this one. Okay. Whether we will have to.
We
go
can
between
see the
Yes, sir.
or through the side matters.
Clear. This is 30
Clear.
Which is 22.
Yeah.
That's 3. Here means 30.
Yeah.
You want to see that? No?
Yeah, we'll see. It's okay. We'll then see the assignment.
there are few veins here. Some sclero can be seen, but we will give at least 1 cc there. And small veins are here.
That also matters.
Can you see the veins? We will give sclero in that also.
It's like a compression and result.
Laser therapy to the knee joint. This
Can
side will heal or not.
Which one?
once we are
Bigger ulcer here. Patient with varicose vein.
Ah,
If we treat the laser therapy till this area, this
bigger ulcer will heal. If that varicose,
same time you have to give STST cover also. No need to give.
STST cover.
Skin grafting.
Skin grafting you can do.
The same sitting.
Same sitting also you can do. If you feel the wound is not healthy, you can do it at a later stage also. Both the ways you can assess. This is short saphenous territory, right? There is already sclero there.
Yes, sir.
Yes.
Okay. Shall not
White
go.
line. Yes.
One white line is the deep fascia.
Hmm.
But in between, when the vessels come, I'm not seeing any dilated vein there.
Actually, for 1 second, also we can use the against now.
Maybe because of the.
Okay.
One more light light off. Yes, sir, 1 second.
എന്ത് പറ്റി
Light on.
It's already passed.
ഇതാ
We'll do clear off for this. Yeah.
that bevel that
Yes. It's a continuous. Okay, scissors. You want to cut only this ear part. So that the other will be staying on the wing.
okay
Yes, sir.
താഴെ ക്ലിയറോ
So I'm pulling this one out. Okay. Now it's a marking again. No? So first I will pull out this, then followed by this. So make sure this is also set. So still some 3% in the it will be beyond that. So this is the safest way.
the specs are there, you can wear the specs.
And we can have two more specs are there. no? രണ്ട് specs കൂടെ ഇല്ലേ? ഇതെന്താ?
connect
Specs കൊടുക്കാൻ വരുന്നേ?
connect okay മതി
ഒരു specs കൂടെ ഇല്ലേ?
ഫ്രീസ് മാറ്റിക്കോ ഫ്രീസ് വേറെ ഫ്രീസ് freeze twice. Okay, sclerosant is there.
Yes, sir.
These veins also sclerosant has entered. Now I am not seeing any veins there.
Yes.
Initially there were a lot of veins there, right?
Yes, sir. Too much close, we can feel that smell of burning veins.
Here also sclerosant you can see.
Yes, sir. Anterior, sir.
Okay,
Yes.
so that is taken care.
Now this is out.
Now any other thing? No marking here, right? No.
Yeah, actually, no, it won't happen, yeah. Because disease was more on right side. Here, except for this.
Yeah, there is sclerosant here. So only you have to give a bit of sclero there. Listen.
Put on, sir.
below the kind, sir.
No, just see here. It's about to be finishing.
അത് അവിടെ കഴിയുമ്പോൾ കൊടുക്കും. ഇവിടെ നമുക്ക് കെട്ടാനുള്ള എടുക്ക.
ഒരുമിച്ച് ഡ്രസ് കഴിഞ്ഞ ഡ്രസ് കേടാം.
ഇല്ല പെട്ടെന്ന് ചെയ്യാം.
How much is the deep fascia? Where is the deep fascia?
Where I have given injections, the deep fascia is very difficult to appreciate. Can you see that white line?
Ah, yes, sir.
That is deep fascia. Below that is the muscle.
Yes, yes.
Above it,
Around 2
subcutaneous
centimeter deep to the skin level.
here,
Yes,
this white line is
Ah,
the periosteum. Because I am over tibia.
Ah.
Just see here.
yes, sir.
That is periosteum.
Okay, okay.
This is deep fascia.
Deep.
Below is the muscle.
Yes.
How much sclerosing on sitting? Here also you can see the deep fascia.
Deep fascia, that white line.
And muscles.
Muscles in the black color.
Yeah, below that.
Below that.
That fascicles. you
Covered
can
with
appreciate.
Yes.
Yes,
Thank you.
Why this last pull? How much?
കഴിഞ്ഞല്ലോ.
Last about the starting part.
How much sclerosing can you use in one sitting?
Chocolate.
Usually one ampule per leg. Usually 1 ampule per leg, or else that much disease only you use more, but don't give more. Be very much conservative about that. Approx 1 ampere per leg will be safe. So 1 ampule will be made into 10 ml. So 1 cc, 2 cc, 1 cc, 2 cc we do inject. ഇവിടൊക്കെ വെയിൻസിൽ കൊടുത്തു കഴിയുമ്പോഴേ it will move in all the ways. So what I looked here is even the short saphenous sclerosant has reached. പിന്നെ ഞാൻ എന്തിനാ ഇവിടെ ബുദ്ധിമുട്ട് എത്തിക്കുന്നത്? അതൊഴുകി എത്തൂല്ലേ ബ്രദർ? ബ്രദർ തുടക്കെന്താ?
Just wait for it. No, we will not. I will put one switcher below and we'll take it. Micro plates. Laser micro. Laser.
വീക്ലാമ്പ് ചെയ്ത് പോകും.
ഞാൻ ഈ മുട്ട് വരെ ഇത് കെട്ടുവാണ് രസനെ, കാരണം സ്ക്ലീറോ ഉള്ളത് കൊണ്ടാ. സിസ്റ്റർ ഗാംജി റോൾ. Sitting extra. ഒരു ഷീറ്റ് അടിയിൽ കയറ്റാം. നിങ്ങൾ ഈ ഫൈബറും കൂടി എടുക്കുക. മാറ്റി കഴിച്ചോ ബ്രദറെ, ഇതും കൂടി എടുത്തോ, വിടട്ടെ. അത് മാറ്റിക്കേ. ഒരു ഗാംജി കൂടി ഒരു ഷീറ്റ് അടിയിലേക്ക് ഇട. വിട്ടോ സിസ്റ്റർ, ഇവിടെ കാല് വിട്, കാല് വിട്. ആ സ്മോൾ ഷീറ്റ് അടിയിലേക്ക് ഇട. ബ്രദറെ തമ്പ്. അടുത്ത ഗാംജി റോള്. Okay, let it be like that. വേണം. Because after sclero we need to check the ultrasound, right?
So here we are telling the chart, ulceration will be more.
No.
It is very thin. No.
No. That is, black spots will be there. Just like laterally here we had. Here we had laterally that black spots. There ulcerations are more.
Usually on the thighs it will be very less common.
Yeah. Monoglide. ആ സൈയില് മാത്രം ഒരു ഇത്തിരി ക്ലിയറോ കൂടി കൊടുക്കാനുണ്ട്. Yes, sir. Ah.
What you have done, maybe 10 minutes, or you want, by the time it's closing, you want to ask something and finish off now? Or after like?
They want to know how the probe is getting connected. Sterile ultrasound probe is getting connected. After this, sclero we will show them.
And then show that now.
ഇല്ല sclero കൊടുത്തു കഴിയുമ്പോൾ it is needed again.
Settings, like how to do
I think then,
Ultrasound settings machine to machine it will vary. Just I will show you few.
okay. After course, before certificate, we can have a sum up session.
Yeah.
10-15 minutes. That's better, no? Otherwise, now nothing will go in.
ടെസ്റ്റ് ചെയ്തിട്ട് കൊടുക്കണേ.
Captain on it.
ഇത് കൊടുക്ക് സ്കാൽപ്പേൻ. എനിക്ക് ഇച്ചിരി ഇത് വേണേ. ലെഫ്റ്റ് അല്ലേ? No, let him do it. ജെല്ലി ഇച്ചിരി തരണേ. ജെല്ല് അത് മോസ്റ്റ്ലി ഇറ്റ് ഇസ് ബിക്കോസ് ഓഫ് ദ ലേസറിന്റെ yeah, here there is vein. Okay, ഇതിലുണ്ട്. Let's put inside that. OCC വേണ്ട, കുറവും മതി. ബാക്കി കളഞ്ഞു. 1.5 കൂടുതൽ വേണ്ടി വരും. 2 വെച്ചോ. ഇപ്പുറത്തേത് അടിച്ചാൽ മതി.
How to calculate, sir?
Approximate on vision, how much ml it will be. Usually 1.5 to 1.5 to 2.53 approx.
Some
Don't-
people, like you're taking 8 and 2. here 8 ml and 2 sclerosant.
Hmm.
Once it is getting lesser, no, they'll take some more and make some more foam and they'll do it.
But
Like, is it
yeah, I'll
effective or?
just let us show you. Remove it. Remove it. Remove it. Remove it. No veins are seen now, right? Right. No veins are seen now.
The other one also is closed.
Yeah. Madi. Yeah. വേണ്ട വേണ്ട മതി കെട്ടിക്കോ just I'll show you two three things ഇത് ഫോട്ടോ ഇത് താഴത്ത് all of you come this side ഒരു ക്ലിപ്പ് ഇവിടെ ഉണ്ട് എനിക്കൊരു മോപ്പ് തരണേ പ്ലീസ് ഗിവ് മീ എ മോപ്പ് ഓക്കെ ഒരു മോപ്പ് താ യാ താങ്ക് യു this camera cover I can load on my hand. I put my hand inside. Like fully. Then they will give me this probe, catch hold with a mop, and put the entire camera cover that side. Then come this side. I told everybody to come this side. This camera cover I will fully put in my hand. A full camera cover in my hand. With this hand, I will hold the probe. Then I will put the entire camera cover that side.
Okay.
Okay. So I got it sterile, right? Somebody hold this. This. Let it. Initially, it was like this. On my hand, sterile camera cover. Okay. After getting the probe in my hand, they will give me the probe.
Okay.
Okay. After that, they will pull this that side so that end is unsterile. This sister will tuck here.
Okay.
What I will do is when it reaches here, I will remove. I will throw off this mop.
Okay.
I will put a bit of lox gel. Give me lox gel. You are sterile, right?
So this one or
Lox gel. Because if it comes out,
it is sterile.
I will keep this gel interface here because through air ultrasound waves won't pass. Then make it like this and now tie this. Now you got this machine sterile in your hand. And here you have to apply either betadine or saline or gel and you can check the patient. You can put a bit of gel here. Here you put a bit of gel. Will you see on ultrasound? Mostly no, because inside my gloves, there will be air. Here also you need to put some gel, then only you will be able to visualize.
Okay.
Whatever is there inside. There should not be any air interface. This part is okay.
Yes, sir.
This is linear probe. Very good for superficial structures. This is abdominal probe for deeper structures.
And this one, yeah.
This one
Depth.
again switch after switching on we need to select the probe. Usually this is common for almost all machines. So probe preset we have to take.
Okay.
So you can see different probes here.
There is written here, probe
Probe
preset.
preset.
Okay.
Patient data we can enter. Probe preset. Usually if it is for abdomen, this probe will be automatically selected. Okay. So here we used to do either vascular or superficial. So you take
Flat
vascular.
probe.
It is 11 hertz probe. Okay. Other will be 4 hertz like that.
This is 3S.
It is 11 L it's written there.
11 hertz.
Okay, sir.
Okay.
So that is
11
select-
linear. That is not 11 L. Okay.
in that we selected
Vascular
vascular.
and either left extremity vein or this is left extremity artery.
Lower
Upper
extremity.
extremity. Lower extremity vein, lower extremity artery, upper extremity vein, like that. Then again, carotid preset is also there. So in this machine, this is a preset.
In
Some
some
other
machines, here it will be the list will be coming.
Hmm.
So wherever the list is coming, you have to select it accordingly.
Either vascular, this is preset, usually almost all machines have it. Otherwise, superficial is also, superficial mode is in all machines. That is also in.
This is the cursor.
This is a trackball, just like mouse.
Okay.
This will be the set.
Hmm.
Or this one. If you are selecting and putting out that, selecting, it will change.
Okay.
Like that. Okay.
That is
Then-
enter button.
Enter. So trackball, this thing, this is the gain. You can see the intensity gain of, this is ultrasonic.
Put a bit of gel here.
Jelly.
Hmm.
So if we turn this, we can say contrast. Contrast is similar to gain.
Can you see the contrast is
Changing.
increasing?
And again, one more preset is there. Yeah, this one. This one, it is actually showing gain in same area. If I increase this, see, upper area is more bright.
Okay.
See?
Okay.
Okay.
So which side is medial?
That one, you can see a, no, here it is a dimple or usually a razor. That one is corresponding to.
You can touch and see
Touch
that.
and see that.
Right.
Okay. If I
No, here you touch, you can see which side it is
Ah.
touching.
Restore it,
Here you touch.
that towards us. That's the only thing.
Okay.
So this again, you can keep either midline or usually it's kept in an angulated position so that we will get the adequate exposure other side. So these many things. will
Then
be needed.
freeze. In between it will get
Between
freeze.
will get, we can take picture or something like that. We can.
Brother, ഇത് ഉരിക്കോ?
So it's the deep space here.
Yeah, depth I will show you. This
Brother,
one,
ഇത്
depth, if it is
മാറ്റി.
increasing, see, this will, if we after, please no, just 1 second. Depth, see, this will increase.
That 4 will increase.
4 will increase.
You will
to
get
5,
deeper
6.
structures. If the patient is obese, you are not getting the depth. You are not seeing the femoral vein or anything that when you are making the Mickey Mouse, then you can increase the depth.
Now
So
I
you'll
will
see the
decrease
deeper
depth.
structure. This is just centimeters.
Centimeters
That will
of-
be increased.
So this one.
And still, if that much depth this ultrasound is not penetrating, you can use this one.
Okay.
Then it will penetrate when the patient is super obese.
Color Doppler we can use actually. This is a power Doppler.
Okay.
I think I'm not, so we never used to do, that is for the ultra, I mean, that, this one will come, see. Here we can see where the flow is. If you put jelly only, this red shows that this, RBCs are coming towards the probe. Blue means RBCs are going away from the probe. No blood there. But if we are keeping in the subfemoral junction and we are asking the patient, I mean, just beyond the subfemoral junction, and asking the patient to do Valsalva. And if red is coming,
Depth is more.
blood
You
is
can
coming
reduce
towards
the depth.
depth to reduce.
Now you are seeing something. Your bones metacarp.
Usually we don't need that, basically. That is for assessing the reflex thing and all. For us, if radiologist is marking there, we can do it.
But they require this
This is
to assess what we told, deep venous reflex and all. When the patient is doing Valsalva, is the saphenofemoral reflex reaching up to the ankle or up to knee or in the mid thigh only? the gradation of reflex, all those things they need to understand. If you are who asked about your ultrasound person, if doesn't know what to tell, then change the person because he's good for nothing.
Most of the report was.
Yeah.
Will give some 50 and the other person will give only 4. So whom to believe and also I also mention the grade of request or the thing to then there is many operators have